Good afternoon. The committee will come to order. Without objection, the chair is authorized to declare recess at any time. Today, the Rules Committee is convening to consider 4 separate measures: H.R. 2483, H.R. 2931, H.R. 2966, and H.R. 2987. H.R. 2483, the Support for Patients and Communities Reauthorization Act of 2025, reauthorizes programs that provide for opioid use disorder prevention, treatment, and recovery. This legislation presents us with an opportunity to build upon the program made in 2018 by President Trump, Republicans, and Democrats when the original Support Act was signed into law. Republicans led the creation of a bipartisan coalition in 2018 in support of that legislation. We have no intention of walking away from our record of progress. We can and should pass this legislation so that every American can receive the treatment necessary to help fight his or her battle with addiction. H.R. 2931, the Save SBA from Sanctuary Cities Act of 2025, would require the U.S. Small Business Administration to relocate offices located in jurisdictions that have adopted sanctuary policies, codifying an announcement by Administrator Loeffler in furtherance of 2 of President Trump's executive orders. Sanctuary jurisdictions across the nation aid in the obstruction of federal immigration law enforcement, and the policies of these jurisdictions pose a direct threat to American citizens and communities. I need not remind our colleagues across the aisle of the wave of violent crime caused by illegal aliens just 1 year ago that resulted in countless deaths of Americans that could have been prevented. Under this legislation, if an SBA office is currently within a city that is the sanctuary jurisdiction, it will be relocated to another area within that same state. H.R. 2966, the American Entrepreneur's First Act of 2025, protects hardworking taxpayers by ensuring that lawful, eligible applicants are the only ones who can access programs that are administered by the Small Business Administration. Let me make 2 things crystal clear. Non-citizens shouldn't be afforded loans and financing backed by American taxpayers. Illegal aliens do not deserve the public benefit at the expense of lawful residents. H.R. 2966 requires the submission of the date of birth for each individual applicant or business owner, certification that each applicant is a U.S. citizen, U.S. national, or lawful permanent resident, or, in the case of businesses, that 100% of owners meet these criteria. Disclosure of alien registration numbers for lawful permanent residents, and certification that no direct or indirect business owner is an, quote, ineligible person, end quote, including asylees, refugees, visa holders, DACA recipients, or undocumented individuals. H.R. 2966 is a common sense piece of legislation that should not even merit controversy or opposition. H.R. 2987, the Capping Excessive Awarding of SBLC Entrance Act of 2025, amends the Small Business Act to require a limit on the number of small business lending companies. This legislation constitutes a rightful overdue fix to a wrong-headed change by the Biden-Harris administration that was born out of its own woke agenda. Unlike certified depository institutions whose primary regulator is the Federal Reserve, SBLCs are primarily regulated by the SBA and are not subject to the same safety and soundness regulations. The SBA's regulatory resources are limited, and its ability to regulate the existing SBLCs was already in question before this change. But the Biden-Harris administration decided that there should be no upper limit with respect to the amount of SBLCs in operation. This move was met with bipartisan concerns for its obvious impact on loan program integrity. This legislation limits the administrator of the Small Business Administration to authorizing not more than 16 small business lending companies that are not nonprofit entities to make loans under Section 7 of the Small Business Act at any time. Democrats need to abandon this reckless policymaking and restore the SBA loan program to the framework that was already working. Anything less will cost our constituents who truly benefit from this program by limiting their future access to loans as the integrity of oversight suffers. As always, I'll happily invite our Democrat colleagues to join us in voting in favor of this slate of 4 bills. With that, I look forward to today's discussion. Now yield to Ranking Member Mr. McGovern for any comments he wishes to make.
Well, thank you, Madam Chair, and I want to begin by condemning, in the strongest possible terms, the appalling act of anti-Semitic violence that happened in Boulder, Colorado over the weekend, which happens to be in our colleague Mr. Negus's district. Let's be clear. Anti-Semitism is vile, it is wrong, and it has absolutely no place in America. And targeting peaceful protesters for exercising their First Amendment rights flies in the face of everything this country is supposed to stand for. My heart is with the victims, their families, and everyone impacted by these cowardly acts of hate. And now, turning to the matter at hand. These bills before us are just another attempt to vilify all immigrants and distract from the Trump administration's disastrous failure to lower costs or do anything meaningful to help the people of this country. By vilifying all immigrants, doesn't make us safer, Madam Chair. In fact, it makes us less safe. It tears families apart and it hurts people, including people like Carol Huey in Missouri, who worked 2 jobs to support her son, who's beloved in her community, and who has been detained by ICE. There is a powerful story about her, which I would encourage every one of you to read, which I would like to insert into the record, entitled, A Missouri Town Was Solidly Behind Trump, Then Carol Was Detained.
Without objection.
Even U.S. citizens are being swept up in overzealous crackdowns. That's not border security, it's cruelty for political gain. And to be clear, Democrats are not denying that there's a problem. We want smart, humane, effective solutions that keep us safe without sacrificing our values. What Republicans are offering is the opposite, a system that lets real threats slip through while largely punishing innocent people. And that brings me to the bills that are before us today. One bill reauthorizes funding for programs that help communities fight the opioid crisis, something that I have supported. But it's hard to take Republicans seriously when Trump and his cronies are actively dismantling those very programs. If they were serious about this crisis, they'd stop undermining the solutions. Then we have the other 3 bills, which claim to support small businesses, but do the exact opposite. DOGE already shuttered an SBA office in my district in Massachusetts, forcing rural small business owners to drive hours to get to the nearest SBA office in Boston. Now, under this bill, if Republicans force the closure of the Boston office out of political spite, it will leave small businesses in Massachusetts with nowhere else to turn. It will have disastrous long-term consequences for the rural entrepreneurs and working-class families in my home state who rely on the SBA to navigate federal assistance and recover from economic setbacks, like the increased costs that they're facing because of Trump's reckless trade war. Because in case you didn't know, Trump's tariff chaos does in fact punish small businesses. Unlike the mega donors who bankroll Republican campaigns, small business owners can't hedge against that kind of volatility. Every time Trump throws another tantrum on trade, Republicans are tossing small businesses into a tailspin with no warning, no help, and frankly, no concern. But maybe that's the point. Republicans aren't governing to help regular people. They're governing to protect the powerful and punish the vulnerable. Look no further than the GOP tax scam House Republicans jammed through the House last month. On the recent pay-for-play pardons handed out to Trump loyalists, people who paid up or praised him. The Republicans' message is clear. If you're rich and you support Trump, Republicans will take care of you. If you're not, you're on your own. They're not in this for working families or small businesses. They're in it for themselves and for ultra-wealthy, for the ultra-wealthy who keep their campaigns afloat. Madam Chair, I think it's disgraceful, and I think the American people deserve better. With that, I welcome our witnesses and look forward to their testimony. I yield back.
Thank you. I thank you, Mr. McGovern, for mentioning the horrific attack in Colorado. I had issued several statements on it, which is why I did not begin with it. But I thank you for bringing it up today, and we'll say something to Mr. Neguse when he's here. I do have a quick word of personal privilege. I recognize the father of Patrick on our majority staff, Mr. Peter Engelhardt, who's here with us from Dripping Springs, Texas. We want you to know, Mr. Engelhardt, that Patrick's doing a fantastic job of staffing the committee, and you should be very, very proud of him. So I'd like the record to reflect that. Thank you for being here.
Madam Chairman, I would just like to welcome him from my home district and my hometown. So,
thank you. Without objection, any prepared statements our witnesses may have will be included in the record. I now welcome our first panel, Chairman Guthrie, Ranking Member Pallone from the Committee on Energy and Commerce. Your full statement will be submitted for the record, and we ask you summarize your statement in 5 minutes. Chairman Guthrie, I welcome your testimony.
Thank you, Madam Chair, and thank you, Ranking Member McGovern, and identify with both of your comments on what happened in Colorado. That is just absolutely tragic and unbelievable that goes on this day, and just sad. Sorry that we're dealing with that. It's just awful for so many of our fellow Americans who don't deserve it. So on dealing with, are we here to help the most vulnerable in our society? I think this bill before us does. And you mentioned that it was a bipartisan bill, worked bipartisan. Matter of fact, the text before us today was actually included in the end of last year's bill. It was agreed upon, and the text of this bill was agreed upon in the four corners as it came to the end of the year bill, which obviously didn't pass. But that's why we're here today, because for far too long, Americans have witnessed the unprecedented rise in drug overdoses and substance use disorders, creating an imminent need for prevention, treatment, and recovery services. The opioid epidemic and its associated overdose deaths have ravaged communities across the country. According to the most recent data, the CDC, approximately 87,000 Americans have died due to overdoses from September 2023 to October 2024. My home state of Kentucky saw close to 2,000 overdose deaths in 2023. While these numbers represent a slight and a welcome decline in overdose deaths, we must remember that we still have these deaths, and each number represents somebody's family member, a friend, or a neighbor, and all of us have been touched in some way. And I'm hopeful these numbers continue to decline and our communities receive a much-needed respite from an epidemic that has gone on for decades. This decline in overdose rates is a result of the significant investments we made in treatment and recovery. The work we have done in the previous Congress, as I reiterate, is bipartisan, that we are reauthorizing today is vital to ensure these overdose rates continue to decline. I'm grateful to be here today to discuss H.R. 2483, the Support for Patients and Communities Reorganization Act of 2025, and how this legislation builds off the important work established by the original Support Act, which was signed into law by President Trump in 2018. We're reauthorizing key public health programs focused on prevention, treatment, and recovery for patients with substance use disorder. The Support Act continues to supply resources for individuals and families impacted by fetal alcohol spectrum disorder, promotes state choice and prescription drug monitoring programs, and allows for educational opportunities regarding the unique dangers of fentanyl-contaminated drugs. I am very proud of the bipartisan work members of the Committee on Energy and Commerce have put into helping craft this SUPPORT Act. This is a common-sense bill that received a strong and bipartisan voting committee. Between both the 118th and the 119th Congresses, Energy and Commerce Committee members have heard testimony from nearly 30 experts on how lawmakers can improve policies related to prevention, treatment, and recovery for substance use disorder, as well as ways Congress can be more proactive in combating existing emergency drug threats. I'm reminded of the powerful testimony presented by Ray Cullen, who lost his son, Zach. He was just 9 days past his 23rd birthday when he was targeted by a drug dealer and ultimately poisoned by the drugs. Ray powerfully recited for us the prayer he read at his son's funeral. He and his family, along with many others, have experienced immeasurable pain from losing a child or a loved one. Their message is always the same. We need to get these lethal poisons off our streets and increase access to both treatment and recovery services for those who need it. I am hopeful that my colleagues will continue this bipartisan work with us in order to further provide these necessary resources so our communities are equipped with the tools to improve prevention, treatment, and recovery services for patients with substance use disorder. This legislation is vitally important. The Senate is ready to act. It is time to get the SUPPORT Act for Patients and Communities Reauthorization Act signed into law. I thank you for your time, and I'll yield back.
Guthrie. Ranking Member Pallone, you're recognized.
Thank you, Madam Chair, and Ranking Member McGovern, members of the Rules Committee. The SUPPORT Act passed last Congress with strong bipartisan support. It even passed on suspension. But it's coming up this week under a rule because a lot has changed since last year. We have a new administration, and the Trump administration is attacking mental health and substance use response efforts on every front. Republicans want to move forward with this legislation. At the same time, they are silently standing by as the Trump administration dismantles SAMHSA, the very agency that is responsible for carrying out the programs that the SUPPORT Act reauthorizes. In the past few months, the Trump administration has completely eroded the mental health and substance use treatment landscape as we know it. It has fired hundreds of workers at SAMHSA, including key senior officials such as the directors of the centers focused on mental health and substance abuse treatment. It has eliminated entire offices authorized in statute that are responsible for collecting data on mental health and substance use and helping people locate treatment services. Eliminating these offices will only make it harder for people seeking treatment to find care. The Trump administration is also eliminating SAMHSA altogether without congressional authorization. It will be combined with other agencies that the Trump administration doesn't care about under the banner of a larger Make American Health Again office. And these critical programs to treat mental health and substance abuse will be deprioritized or eliminated in favor of Robert Kennedy Jr.'s pet projects, like destroying Americans' access to vaccines. The Trump administration is also threatening our efforts to address mental health and substance use disorders by rescinding over $1 billion in essential funding that states rely on through block grants. The administration has also proposed eliminating 40 different mental health and substance use programs, including 8 programs reauthorized by the SUPPORT Act. And this includes programs to train first responders who respond to opioid overdose calls, provide residential treatment to pregnant and postpartum women, and support people in long-term recovery. In fact, the Trump administration's budget goes further and proposes eliminating nearly all of the SUPPORT Act programs, as they propose to eliminate all so-called programs of regional and national significance, or PRNS. This is the umbrella under which nearly all of the support programs reside. And so let me be clear, this is not a budget proposal in the traditional sense. This is a roadmap for what the Trump administration plans to do unless the federal courts prevent them from proceeding. Their expensive and limitless, I should say, their expansive and limitless view of the president's authority knows no bounds. If DOJ wants to cut entire agencies, eliminate programs, and impound funds, they will do it regardless of the law and regardless of what you do here. Unfortunately, Republican majorities in both the House and Senate silently sit by and watch all the destruction and illegal actions. House Republicans have not conducted any oversight of this administration. Instead, they dodge and evade their basic constitutional duties to conduct oversight of the executive branch, ignoring the needs of their constituents out of fear, I think, of the wrath of Trump and DOGE. And to make matters worse, just 2 weeks ago, House Republicans passed the biggest cut in Medicaid in history as part of their effort to fund giant tax breaks for billionaires. Medicaid covers 40% of all Americans with opioid use disorder. Gutting the program will leave millions of Americans without access to life-saving care. And all of these actions completely undermine existing efforts to address substance use disorder in communities across the country. Americans will suffer, and yet this does not seem to matter to the Trump administration. So let me be clear. These decisions will have disastrous and deadly consequences on the millions of Americans impacted by substance use disorder. So I think the problem here, Madam Chair, is that Republicans are saying that we're going to conduct business as usual in Washington, we're going to reauthorize the Support Act. And if that were the case, that we were just reauthorizing the program, providing the funding, not dismantling SAMHSA, I would join them in supporting this bill today, just as I did last Congress. But the Trump administration is not conducting business as usual, and I don't think Republicans are doing anything to fight back. And therefore, I can't support the bill while our mental health and substance use treatment infrastructure is basically being attacked and dismantled. So with that, I yield back the balance of my time, Madam Speaker. Madam Chair, I'm sorry.
Thank you, Mr. Pallone. Chairman Guthrie, would you like to respond to anything the ranking member just said?
Well, thanks. I just want to say there has been a reorganization of SAMHSA, and these are the programs that we support, and I strongly support these programs and fight for these programs. If the administration can do them more efficiently and they can do them better, as long as these programs get accomplished, that's what I want to work on. But if you look at the reduction in force at SAMHSA, my understanding is that the programs authorized in this piece of legislation haven't been affected by that reorganization, so that obviously states that the Trump administration has these as a priority as well. And so I want to get this support and fight for these programs and make sure they're successful.
Chairman Guthrie, it seems that a lot of the amendments that were submitted in committee and here at Rules conditions the implementation of the act. In effect, this would inevitably delay the authorization, which belies the other views expressed that this federal support is so critical. If I could just summarize the self-defeating logic of some of these amendments. They believe the Trump administration won't follow the law, but then they want the Trump administration to certify they will obey the law. And they want President Trump to sign the law that they believe he won't obey. So if Democrats have problems with how the executive branch is dealing with appropriations, would it make sense to use the appropriations process to address their concerns and not jeopardize this bipartisan effort?
Well, thank you. That's a great question, and we've seen the results. We do have lower number of instances of overdose deaths because, one of the big parts of the bill is that we took naloxone off of prescription, that you have to have prescription for naloxone. So before this, technically, if somebody had an overdose, you had to found them, call a doctor, get a prescription, send it to the pharmacy, go pick up the prescription, and administer it. By then, obviously, it was way too late. And so what was able to happen is that now it's with the emergency responders. And my understanding is it's even with people who has substance use disorder, they keep naloxone with them. So the point is any delay can be deadly. And so we just want to make sure that we don't. And obviously, the appropriations process is the right place to, if you want to fight the battle on appropriations, that's the right spot for this.
Thank you very much. Mr. McGovern, you're recognized.
Well, thank you. And this is very serious stuff, I think, for all of us. Drug addiction and overdoses continue to devastate families in my district and communities all across the country. Over 20,000 lives have been lost in my home state of Massachusetts alone to this crisis over the past decade. But in Massachusetts, we saw a 33% drop in fatal overdoses for the first time last year. I think what it shows is that public investment in treatment and prevention are starting to make a real difference. And that's why I, in the past, have supported many of the programs that would be renewed in this bill, including programs to train first responders and how to treat overdose, provide special treatment for pregnant and postpartum women, and help individuals in recovery reenter the workforce. But I'm also concerned, and I should say I'm outraged, quite frankly, that the Trump administration is actively dismantling our ability to respond to the opiate crisis moving forward. Now, the administration recently sent over more details about Trump's so-called skinny budget, which proposes very large cuts to health programs that American families rely on. These include eliminating programs of regional and national significance at the Substance Abuse and Mental Health Services Administration, or SAMHSA, which encompass nearly all of the programs aimed at substance use and mental health, including the ones in the bill before us today. And so, Chairman Guthrie, I mean, do you agree with President Trump that Congress should eliminate funding for these programs? And are you aware that many of the programs reauthorized under the Support Act are the ones that the Trump budget requests want to eliminate, such as support for first responders and pregnant and postpartum care for women?
Well, I understand that the budget, the executive proposed budget is always a starting point, and I support these programs. And so I'm going to fight for these programs, and as put this forward to the appropriations process, because I think these are important to have. But my understanding that when they did the RIF and the reduction in force in SAMHSA, these programs weren't effective. So I think these are a priority for these to have in the programs. My understanding, they're taking.
That's not my understanding of what he's sent up to the Hill. And I mean, doesn't it concern you that these programs are on the chopping block? And what's the point of reauthorizing programs if the administration is going to arbitrarily cut them?
Well, I think that it's our job to reauthorize the programs and have them in law. And my understanding of what they want to do is not eliminate the programs, just move them into a streamlined process.
Well, and we don't have the
Into the
details of what the
AHA.
streamlined process looks like. And by the way, I thought the way it's supposed to work is if Congress passes laws and appropriates money, the administration needs to follow those laws and to spend that money and not make these arbitrary, cuts. I mean, you introduced a bill, I think, on March 9th, 2023, called the Comprehensive Opioid Recovery Centers Reauthorization Act of 2023. Am I correct?
Right.
Right. I mean, are you aware that the president's budget request proposes to eliminate funding for that program?
Well, my understanding is they're moving it into another account where they streamline all these programs into one specific account. The AHA
Mr. Cohen,
account.
do you have a?
Yeah, let me just, I don't want to speak too long, but I just want to explain, for all of you understand, I'm not one of these people who thinks that we shouldn't work with the Republicans and work with the chairman if we can accomplish a goal. I don't come here and say we should support the Support Act. We should oppose the Support Act if I thought that was something happening here that was actually positive. But I don't think that's true here, right? In other words, look at this. The Support Act reauthorizes the SAMHSA programs. You have an administration that's saying we're going to get rid of SAMHSA altogether. We're going to put it in this new administration for a healthy America. I don't believe, looking at that it actually is going to keep SAMHSA effective, right? Then you have $1 billion in rescissions that have already been out there, money that's already been obligated for all these treatment programs and education programs in the country, right? Then there's that. Then you have a budget now that eliminates almost every one of the programs under the Support Act, that this is what the administration is proposing. And I could go on and on. The point is, why are we reauthorizing this bill when everything that we're reauthorizing is going to be gone? And the simple answer is, in my opinion, because they want to show that they still support these things. And maybe the chairman does, but it doesn't matter because they're going to all be gone. So I think we have to say, let's not act as if we're supporting this at the same time that all these things are being eliminated that are meaningful in a real sense.
Yeah, I'm all for working in a bipartisan way. We have in the past, and we've actually, authorized many of these programs. And I'm here to tell you that, that has helped in my home state of Massachusetts. As I began, I said that we saw a 33% drop in fatal overdoses for the first time last year. And that wasn't by accident. It was because of some of the federal support that actually made a real difference and saved lives. This isn't just about what the Trump administration is proposing to do. It's about what they're already doing, right?
That's correct.
Taking a sledgehammer to SAMHSA. the federal agency tasked with administering our federal response to the opioid crisis, by firing hundreds of federal employees and closing offices around the country. So, Chairman Guthrie, there have already been massive cuts at SAMHSA. I understand that Ranking Member Pallone and his staff on the Energy and Commerce Committee have yet to receive a response to their repeated inquiries as to how many staff have actually been fired and which offices have been closed. Have you or your staff received that information?
I don't have knowledge that I have that information. I'm not saying that we haven't, but
It would seem to me like this is information that we should have, but especially as we consider the Support Act reauthorization, which will require adequate staff to implement all this stuff. So, as we highlighted at the last rules meeting, President Trump and congressional Republicans are also attempting to rip health coverage away from nearly 14 million Americans through cuts to Medicaid and the Affordable Care Act by refusing to work with Democrats to keep the enhanced premium tax credits in place. Are you aware that more than 1 million people receive medication treatment for opioid use disorder, the gold standard for opioid addiction treatment, through Medicaid?
and we exempt that in the work requirements. It is in Medicaid. And we exempt in the work requirements for able-bodied, we specifically define out in statute that people suffering from substance disorder and treatment are exempted from that.
Well, data from the Joint Economic Committee shows that most Medicaid patients who receive medication treatment for opioid use disorder can only afford to do so through the Medicaid expansion. So if you want to combat the opioid crisis, I guess the question is, I don't know why you guys voted for the largest cut to Medicaid in history, but the president also says he wants to eliminate SAMHSA altogether. And as a reminder, this is the federal agency responsible for combating the opioid epidemic. Do you support eliminating SAMHSA?
What I support is making sure these programs are implemented and the missions are implemented. If there's a way to offer up that we can look at and take through our committee and hearings, and they're going to do it more efficiently and better, as long as the core mission is accomplished, I'm open to listen to that. But absolutely, we've seen, as you said, the decrease in deaths that have happened from our work and our legislation. I'm open to how it gets delivered, but I want to make sure it's delivered.
Well, with all due respect to the people who are currently in the White House, I mean, I think I would feel a lot better if I had the details about, if they're going to streamline or they're going to transition programs, exactly how it's all going to work before we do this. I mean, the president mentions the new administration for a healthy America. I mean, don't you think that our nation's mental health and substance abuse issues are serious enough to merit the focus, of an independent agency like SAMHSA? I mean, I'm just worried that you start spreading this stuff out all around the place, and there's not a primary focus, and then you end up, things start falling through the cracks. Look, at people watching at home may be wondering why there would be any controversy surrounding Support Act programs, given it has historically been a bipartisan issue. And let me just, my final question to Mr. Pallone is, I mean, can you explain what has changed since the House passed a similar version of this bill in 2023? And why wasn't this signed into law at the end of last year as part of the bipartisan bicameral health package?
Well, the problem was we had a bipartisan agreement in the end of the year appropriation omnibus, and we were literally on the floor ready to pass it, having the debate, when Elon Musk got up and said, oh no, we're not doing this. And I think he did like a tweet or something. And then literally after he did the tweet, while we were on the floor, everyone said, oh no, we're not supporting this anymore. We're going to go and take all these, not only the Support Act, but I don't know, maybe 40, 50 other bills, many of which were healthcare oriented, out of the bill. And that's what they did. I mean, the other thing I wanted to state, if I could, Mr. McGovern, is that, you talked about how, these programs, SAMHSA and the other Support Act programs, exist in your district and how effective they've been. The bottom line is, as you know, and I think most of the members of the committee know, most of this treatment and education that's effective is done on the local level. Right. And that's the thing, one of the biggest things I'm concerned about is that the elimination and really all the money that goes to these programs of regional and national significance, and that's the umbrella which you get all these local programs, treatments, and that's the roadmap, if you will, of the Trump administration to eliminate all this.
Yeah, and let me just, Chair Guthrie, look, I I know we all share the same commitment here. We want to see overdoses and deaths go down in this country due to the opioid crisis. I just worry that by just kind of putting all of our trust into the administration without the details, that we're making a very, very serious mistake. That some of these programs are going to fall through the cracks. Some of what's working, as I said in Massachusetts, it is working. We can document that it's working. I know it's working in other parts of the country. That we all know this, and we're having these discussions, but it's not being translated at the executive level. And I don't want us to go backwards. I want us to go forwards. And I'm just afraid that, again, what the administration is proposing in their budgets and in their statements, and, you know, to me is frightening. And the lack of details from the administration is also not reassuring to me. And so I just say that because I know that you care about this stuff as well. With that, I yield back.
Thank you, Mr. McGovern. Mr. Roy, you're recognized.
I think, Chairwoman, and I'll be brief, I think, Chairman Guthrie, I mean, is the administration simply trying to reconcile a post-COVID universe with respect to how much we're spending on programs and try to get our budget in shape in a post-COVID world and maybe try to return to a pre-COVID trajectory or better? Is that not a fair statement?
That's accurate. My understanding is if you look at the reduction in force in HHS, these programs have not been effective. So it shows that even though they're reducing force, the administration makes this a priority. The other thing is, how do you streamline these programs into a more efficient, better way to do business? And I think we should be open to that. We won't go into it blind. We'll obviously do our homework, but you're correct.
Well, I think the chairman, and I think that is, you know, an appropriate thing for the administration to want to do in terms of what they're doing with resources. Now, I will say, you know, I'll support this rule. I did not support this bill when it came to the floor last time, as the Support Act or whatever the language was. But you know, we all have districts, and the gentleman from Virginia does, and we all do. We all have districts where we've got folks for whom programs are very important. People who have opioid addictions. Obviously, we've had a fentanyl crisis. We have all these different issues. I would note that, you know, I saw a headline the other day in the Post or the New York Times or somewhere saying, well, we're trying to figure out why fentanyl seems to be going down at the border. And I'm like, well, I wonder why. I wonder why that might be happening. Maybe if you actually secure the border, maybe you can minimize some of the fentanyl flow. But putting that aside, we still have people with massive addiction problems, and we have programs that are beneficial. I have people who come to my office. Many of you know I'm a cancer survivor. I have people come in asking for support for money for cancer programs. People, ALS support programs. One of my dear friends passed away from ALS. We all want programs for people. I happen to just believe that you got to deal with that through civil society and the state and local level, and that we're $36 trillion in debt, and we're, at best case scenario, with the budget that we put forward, still looking at $2 trillion in debt a year, give or take, depending on economic growth. My colleagues on the other side of the aisle will say, don't worry, tax the upper brackets. Okay. I mean, I asked CBO to give me some numbers. If you tax people who make over $5 million at the 43% rate, which was the rate at the end of the Clinton era and in the 2000 range, it would give you about $300 billion over 10 years. Okay. Putting aside the dynamic impact, that's $30 billion a year. My point is just, that ain't the problem. I mean, it could be, we could put that into the mix, but that ain't the problem. The problem is we keep saying yes to every program under the sun. We keep, you know, President Reagan said in a great interview with Johnny Carson, he said, every proposal that a member of Congress puts forward should come with a tax increase attached to it. Because we should have to say, we're going to be spending X, and so maybe we need to figure out what the revenue stream is going to be for X. So as much as the program might be laudatory, I'll not be supporting the bill on the floor. I'll support the rule, of course, because it's something that the majority wants to move forward with. But I just believe we've got to be serious and not pretending that authorizations don't ultimately end up in appropriations. Because whenever we authorize programs, we end up appropriating for the programs. And I think the administration was correct to send up the restrictions and the reductions in spending on the non-defense side that they sent up in their budget. I think we've got to get serious about constraining the size and scope of government. So I'll just note that, and I'll yield back to the chairwoman.
Thank you, Mr. Roy. Ms. Scanlon, you're recognized.
Thank you. think we have to thank our colleague for his refreshing candor that he's not interested in supporting SAMHSA and the opioid treatment programs, or apparently some of the other disease programs that the federal government has supported over time. Look, there isn't a single district in this country, and probably very few families, who haven't been impacted by the opioid crisis. It's been heartening to see that we've been able to make some progress over the last decade or so in forms of treatment, in rolling out treatments in our communities, to get people the help they need to overcome addiction. Because you can't just do this from the supply side. You have to address the demand side, the people who have the addiction. So agencies in my community like Mental Health Partnerships, SPIN, and Horizon House have been instrumental in helping people in our region receive treatment and succeed in recovery. And as Ranking Member Pallone noted, under different circumstances, H.R. 2483 would pass as a suspension bill, one that has bipartisan supermajority support in the House, and not one that has to come to the Rules Committee. But here we are, and it's important to understand why that is. You know, this bill cannot measurably reduce opioid addiction so long as we don't have the resources and the agencies able to provide that support to our local communities. And so long as our Republican colleagues fail to stand up to the Trump administration's actions, which are undermining the very programs that address substance use disorder. You can't claim to support efforts to address mental health and substance use disorders while turning a blind eye to the gutting of the federal programs that address those agencies. You can't earnestly say you want to help people struggling with addiction, but be silent when DOJ fires nearly half the staff at SAMHSA, which leads those efforts. You can't be silent as the White House illegally rescinds over $1 billion in federal funding to support state and local behavioral health programs that treat substance use disorder. Now, I mean, I know that there are members of the Republican conference who really care about helping people with addiction, but you can't be taken seriously as long as you turn a blind eye to the gutting of the programs that are going to help us do that. You can't have it both ways. So right now, while we discuss this bill, the president's proposed budget would cut funding for the Department of Health and Human Services, which leads our national addiction relief efforts, by 25%. And specifically, the White House is proposing to cut $1 billion for SAMHSA, the Substance Abuse and Mental Health Services Administration, the very agency tasked with carrying out many of the provisions authorized by this bill. DOJ and Secretary of Health and Human Services, RFK Jr., have fired thousands of employees and rescinded hundreds of existing grants that were already committed that agencies, our local agencies, were relying upon. So you can't be silent in the face of those actions. You know, we're obviously ready and willing to work with our colleagues to provide real solutions and resources to fight the opioid crisis that is devastating far too many communities and far too many families. But it's important that we're honest with the American people and not say that this bill is going to provide those solutions or resources when under current conditions it cannot. Representative Pallone, you talked about the local level and how these programs have to be implemented at the local level. And we've heard from both of our witnesses here today that SAMHSA is actually having success. We are meeting some of the challenges of opioid abuse. I met with our community mental health providers in April, met with about 15 of the different agencies. These are the people on the front lines, meeting people with addiction where they are, bringing them into treatment. And if anyone here has had family members who've been addicted, you know it's usually not the first time that you try to get someone into recovery that it sticks. So it's an arduous process for everyone involved. And I heard from our local agencies how much they rely upon the expertise of SAMHSA, how much they rely upon the federal funding to do their job. And quite frankly, at the time they were reeling because many of them had just gotten these notices from the federal government, like so many of our nonprofits are getting, saying, your program no longer meets the priorities of our agency. I mean, I think that says that the agency's priorities are misplaced at this point. This is money that Congress has appropriated. This is money that our communities are relying upon. I understand the desire to disrupt bureaucracy, but we seem to have a bureaucracy here that is working for folks, and disruption for the sake of causing chaos doesn't help any of us. You got to have a plan for how you're going to make it better as opposed to just tearing things down. So, Ranking Member, can you speak a little bit to the impact on the agencies that are doing this work in our communities of what we've already seen and what the proposal in the president's budget would do? Absolutely.
And let me just say, look, we're an authorizing committee, and, we can talk about the funding, which is so crucial. But, I've never liked the idea of, my getting up or any of us on Energy and Commerce getting up and saying, oh, we authorize this program, and then there's no money for it, right? Because it's just not fair. You're kind of giving the impression you're doing something when in reality you're not. And so that's my biggest concern here. I don't want to act like I'm doing something when in fact I'm not. In fact, it's the opposite, right? And the other thing is, you pointed out, is that, SAMHSA doesn't just provide the funding for these local programs, they also provide direction in education. Mm-hmm. This isn't just about treatment. Treatment, obviously, very important, but it's also education because, it's kind of like you said, there's three things. One is the enforcement to try to make sure that the fentanyl doesn't come in, which, Mr. Roy mentioned. And then there's the funding for the treatment for people that, need help. But there's also the education, because I don't think we're going to ever eradicate, drugs. I mean, there are people that literally think that, they're going to take opioids and after they go to the hospital, whatever, and it's going to be okay, and they're going to be fine, and they get addicted, and they need treatment. I mean, a lot of people are not intentionally taking drugs. They take it after they have an operation or something, and then they find out when it's too late, that this has addicted them. So you need all of this. But the bottom line is it's expensive. And Mr. Roy is not wrong when he says it's expensive. But what's the alternative? The alternative is that people just die and we don't deal with it. I mean, it's always a question. A budget is about priorities. And what the Trump administration is saying, in fact, is this is not a priority. Mm-hmm. We're going to rescind $1 billion. This is not a priority. We're not going to fund these programs in the future. This is not a priority. And most of this treatment is done at the local level. So if you take away the money and you don't give the grants, as I talked about with these, regional and national significance, they're not going to have the money. And right now, even though they're making a lot of progress, and everybody's admitted that, there's still not enough money, and there's still not enough treatment plans. And if anybody here thinks, and I don't think you do, that you can do this privately, forget it. I mean, have you checked out some of these ads on TV about these treatment programs and how much they cost? They're not covered by, thousands and thousands of dollars, way beyond the reach of the average person if you got to pay for it all privately. So, I mean, that's the best I can say in response to what you brought up.
Well, I think you're right, and it is about priorities, and it is about where we invest the taxpayers' funds, and I think investing in people to help them get rid of the substance abuse. I mean, I've heard from so many of our union members, someone gets injured on the job, they end up being given some medication to get over it, and then they get hooked, and they're in this situation. There's just so much going on, and of course, just telling people, we're all going to die doesn't really cut it. I think we do need to invest in these programs. I think the way that the money has been pulled out from under these programs is a huge problem, and we're talking about a lot of programs that are not these, top dollar, tens of thousands of dollars in cushy conditions. We're talking about places that are meeting people where they are in our communities, day programs, et cetera, and they're really, really necessary. So I think we need to make it a priority of our agencies and administrations, and you can't do that without funding or personnel to administer it. So thank you for your testimony.
Thank you.
Thank you, Ms. Scanlon. Ms. Fishbach, you're recognized.
Thank you, Madam Chair. And Chairman Guthrie, is there anything you'd like to respond to regarding the last questions?
I
and
just want to say
answers?
that we agree that people with substance use disorder, and Mr. McGovern also brought up that a lot of people get their treatment through Medicaid. And I just want to stress that we specifically exempted people with substance use disorder, and we wanted to define, and I believe we strongly defined that the people who have to work to get Medicaid are able-bodied, And we we went back and forth to try to get the language right, because we want to make sure it was correct, the term medically frail, because somebody came to my office, and what if somebody gets diagnosed with cancer in the work requirements? And said, well, medically frail, we've got all this in. So we put those in there. We specifically put substance use disorder, because we didn't want anybody in the future to say, well, that's not medically frail, that's a decision that people make, or people get addicted to that. And so I just want to say that we specifically did that. And then the reduction in force in SAMHSA, I'll still bring out that these programs have been a priority. Even with reduced staff, they're focusing on these programs, and we look forward to listen to the proposal from the administration, and we want to make sure that, I think most members of Congress want to see this move forward.
And just as a side note, I appreciate the work you did on the reconciliation bill. I mean, I know that, yes, what was it, 22 hours? But it was far more.
26, wasn't it?
Well, it was far more hours than that, honestly, because you had worked on it for months before. So I appreciate that, and I think you really did. You were able to thread the needle on that and make sure that the program was still, was strong, and that the people that needed it will get it.
Thank you. Appreciate
And so
that.
I appreciate that. And with this bill, I appreciate you bringing this one forward, because, I hear from law enforcement and from medical professionals in my district that we need programs, and I think this will help strengthen the ones that Trump put into place in his first term. So I appreciate you bringing this forward, and I just wanted to actually give you the opportunity to respond, and I appreciate that you did. So with that, I yield back.
Thank you, Ms. Fishbach. Mr. Langworthy, you're recognized.
Yes, Chairman Guthrie, thank you for being here today. Ranking Member Pallone, it's always good to see you. As multiple people have pointed out already, we've seen real decline in the numbers, in positive yardage being made on this crisis. I mean, we went from 83,000 overdoses in 2023 to just under 55,000 in 2024. How has the support for patients and communities that contributed to this decline, and how could this positive trend be impacted if we don't move forward with reauthorizing these underlying programs?
Well, the biggest effect on overdose deaths. So we try to look at what's the difference in overdose deaths and just incidents of overdoses, overdose deaths, were the training for the emergency professionals, the access of naloxone on the spot, so you didn't have to, by the time you have someone that's overdosed, you discover that, and you have to go to a pharmacy to get a prescription is obviously the time is just critical, the timing. So that's been the biggest part of it. But I know in my state, I can tell you, and a lot of it through Medicaid, that's why not just because it's my state, but I understand it and work to exempt, is that people have access to this treatment because of Medicaid. I had a lot of state legislators, when some of the proposals were being bandied about in the bill, the reconciliation bill, and I think access to treatment, but you can't dismiss just the access to life-saving naloxone, which my understanding is one of the other, it starts with a Z, I can't think of, I can think of it right now, doesn't respond to naloxone. And so that's a scary thing that we have to focus on as well.
All right, well, thank you, Chairman Guthrie. I do think our colleagues across the aisle here need to take a little bit of a break from the never-ending opposition to President Trump and the administration, and remember that programs under this bill work, they should be reauthorized, and they can continue to help save lives in communities across this nation in all 50 states. And with that, Mr. Chairman, I yield back.
Thank the gentleman for yielding back. Now recognize myself for questions that I may ask. Good to see you both. It's always good to work with you both, and sometimes we have disagreements, but we try to work them out. One of the things that concerns me, Chairman Guthrie, is some of the programs inside the Support Act are programs that are already helping. That's part of the reason why we have had a reduction. It's not the only reason, but it's part of the reason we've had a reduction in the overdose deaths, et cetera. Can you talk about the importance of Section 103 of the Support Act that would bolster the ability of prescription drug monitoring programs to track the prescribing of prescription drugs both within the state and across state lines?
Well, it's vital, because one of the big problems that we saw in my home state, I was actually in the General Assembly when this first kind of took over, the first wave. A lot of it was in Appalachia, and a lot of it was in the Medicaid community. And it was legally prescribed drugs that I know judiciary and others have taken on with it, just, in Virginia, we see in West Virginia, just the overprescription of OxyContin and those drugs. But in that time, what people would do is get a prescription and go from pharmacy to pharmacy to pharmacy and just get drug after drug after drug. This prescription, so actually it was Hal Rogers, who was our colleague, the dean. Dean Rogers put in a program that he got through appropriations process, wasn't authorized, got through the appropriations process to help set up that people could, that if you went to I won't call out any of my cities, but if you went to this city in Appalachia's pharmacy, and you went to this other one on the other side of the hollow, then they knew it. They knew it. Well, the problem also came if you're in my great state. I'm 26 miles from the Tennessee border. You're right on the border with my Commonwealth, and so going across the border, that's when we have to do it. This is one thing that really needs to be federal, because you can't just have a Tennessee system, or Virginia system, a Kentucky, or a New Jersey, New York system. I know the tunnels there, you can just go back and forth pretty easy. It's important that this piece is federal, because people can go across state lines pretty easily. And fortunately, we've cracked down on OxyContin, we've cracked down on a lot of other things since then. But this prescription drug monitoring is important, because you know that this person is getting the same prescription filled 3 or 4 or 5, 6, 10 different places in some cases, and this prevents that.
Yeah, and what made that even more complicated is one of the reasons that I introduced this section. How did work? I did work. We've all done work in this area trying to solve the problems. Is that we calculated if you really put your mind to it, and you lived in my district, you could actually get a prescription filled in each of 5 states in a single day. Because if you'd have to work it. You'd have to start early in the morning and go to whenever the pharmacy closed down that evening. But I border West Virginia, Kentucky, Tennessee, and in fact, they're at one point, all 3 states, Kentucky, Tennessee, and Virginia all come together, and you're only about maybe an hour from West Virginia at that point. And then you've got North Carolina just down the road as well. So you could actually, swing through the Cumberland Gap, hit Kentucky, Virginia, be down in Tennessee, and as you cross Virginia and go into Johnson City, Tennessee, think of Wagon Wheel, the song, you can suddenly be in North Carolina in about, 30 minutes from Johnson City. So, I mean, it would not be impossible, which is why this is so important. But more importantly, for those who now, and I understand they're frustrated with some of the things that are going on, but for those who say, well, I used to support this, but now I can't, this will take away, if we don't pass this, will it not take away some of the programs that have actually been part of the solution?
I'm understanding the authorizations will expire.
Yeah, Section 103 clearly expires. Let me talk some more about Section 103, because it also allows for the analyzing of wastewater monitoring to track any patterns related to prescription drugs. Why is utilizing wastewater monitoring so important in our fight against substance abuse and illicit drugs?
Well, so the wastewater monitoring sees what kind of opioids or any kind of drugs are in the wastewater. So if there's obviously where the wastewater is flowing from. So if you test the wastewater and you say high incidence, the good thing about it is you can't identify who the wastewater is coming from, but you can see where it's coming from, so you can kind of make decisions about where to deploy resources. If one region, if you're in a section of the Commonwealth of Kentucky and there's a high incidence of wastewater, of having opioids in the wastewater, that's an area you need to concentrate on. But you can't identify the person that wastewater came from, which that's why it's a good tool to monitor, actually.
Yeah, I mean, I'm a big fan of checking wastewater, not just for the reasons you stated, and maybe we need to figure out a way to have it go across multiple agencies, but because we also can use it for disease tracking, not just the disease of substance abuse, where people may be, having that, but for folks back home, this is, it gets a little bathroomy, but the truth of the matter is that whatever's in your body flushes out, and it ends up in the wastewater treatment center. What we also know is we can find phage viruses which attack bacteria in that same wastewater. So we probably need to, if we have somebody out collecting wastewater in various sites, they might ought to be getting extra samples for our researchers who are doing work both on monitoring disease at CDC and doing work on phage possible cures. you would.
Right, and it protects your privacy. Like I said, you don't know where the wastewater.
That's right. I have no
who-
idea
Who the
whose-
wastewater came
whose
from.
waste it is, but
Yeah.
we know it came from somebody.
Exactly. It's a good way to monitor.
Yeah, let me raise this issue too, because I think we all agree that a lot of these programs are very helpful. But, and this does not mean that the programs aren't doing some good work, but you may recall that you and I and former Chair Kathy McMorris Rogers sent a series of letters in 2023 because we were having a hard time tracking down exactly how SAMHSA had spent $8 billion that was allocated for COVID response, and that even when we got an answer back, we didn't get full answers, so then we had to write more letters asking to give us documentation, both on how they were spending money on that $8 billion, but also $900 million that was invested in the 988 crisis care system, which deals directly with suicide and mental health issues. And we just couldn't get those answers tracked down. So while I recognize that SAMHSA has done some great work, and I think there's a lot of positives, we also we didn't get cooperation on trying to figure out where all the money was going. So it's a little disingenuous, would you not agree, to say that trying to rein it in or figure out how we can be more efficient is not an appropriate response in some ways?
I think it's appropriate, but we want to accomplish the mission.
We want to
I think
accomplish
it's
the mission,
appropriate to be-
absolutely. And they have done some great work over the years, but that doesn't mean that any agency might not get a little out over its skis sometimes, or in a situation where they're not as effective as maybe they could be with the amount of money that we're spending in there. I mean, the one letter that we wrote was about $8 billion. And then you're talking about $900 million for the other, which had a serious hacking incident. And they asked us, they said, well, you can just go get your answers from the FBI, which didn't really seem very satisfactory at the time. Anyway, with that, I will yield back and now recognize Ms. Leisure Fernandez. Thank you.
Thank you very much. Thank you, Chair, and thank you, Ranking Member, for being here. And I need to just share you at the outset as we began the questioning that I lost not one but two brothers to substance abuse and mental health. And I lost them at a time when in New Mexico, we were not providing the kind of mental health and assistance with drug abuse that we know saves lives. And so this issue for me is personal. It's personal for New Mexicans. It's personal for rural communities across this country. And it is therefore really difficult for me when we see that these programs are so important and make a difference and are supported by somebody like you, right, Chair? You're here because you believe these programs make a difference. So it's really frustrating when we see that the president's budget doesn't really fund them, and when we see that the president is firing the people that carry out these programs. And so that's why it's difficult for me when I deal with these issues, because it seems like there is a disconnect between your beliefs and values and what the president is doing. And I think that that is something that has been brought up earlier, and that is reasonable for us to wonder about. So I guess I would ask, and you already said, you absolutely believe in these programs. Do you believe they should be funded?
I do believe, and I think we ought to give credence should they be more, can they be more efficiently brought forward, and the White House comes and makes the case before Congress, and we look at their budget, if they can do them more efficiently. I absolutely believe this mission with prescription drug monitoring, prenatal, I could go through the list, but that all needs to be, it's a role that we have that we need to help communities.
So have you criticized the firings of the people who work at SAMHSA?
Well, I want to give people the chance to do things in an efficient way if they can. Of the firings in SAMHSA, these programs have not been affected by those firings. My understanding is that's what's been relayed to us, and so it shows they're making these a priority.
Well, what we have here that, the director of the Center for Mental Health Services and the director of the Center for Substance Use Treatment are no longer there. These are precisely the kind of programs that we need to be supporting and that the bill would look at supporting. That's the information I have, and is that, Ranking Member, is that information correct?
Your information is correct, but there's also the fact that there's over $1 billion in rescissions for the state and local programs. So the money, even though it's been obligated, has been rescinded. Whether or not the people in charge are there, the money's gone.
Right, and I think we need to remember that you can't say we support these programs and then not speak out or vote against and advocate against the firings. I mean, you cannot have it both ways, right? You cannot, courage means standing up for these programs, even to a president of your own party. And you know that we have stood up to the president of our party when we thought he should be doing better. And it's not surprising to me that President Trump would be doing this to these programs, because I recall, because I remember these things because of the personal nature, that when he was running, he said, and I believe this is the quote, "And for those who are severely mentally ill and deeply disturbed, we will bring them back to the mental institutions where they belong," close quote.
I mean, the problem is that, from my perspective with President Trump, is he talks about the drug crisis strictly in terms of the border, right? He says, we're going to stop fentanyl and the drugs from coming into the country. But that's only part of the problem. You still need the treatment, you still need the education, you still need the direction at the federal level. And if you fire the people, I mean, they're, it's not just the heads of SAMHSA. He's fired a lot of the people that are actually work there that are, more rank and file, or whatever you call it, as well as rescinded all this money.
So we need to both stop, we need to address the security issues of fentanyl and other things flowing into the country, but we also have to address the demand. We have to treat mental illness and drug addiction as a health care issue.
Absolutely, and it's an education issue, because otherwise, we've talked already about this. People start taking these opioids and other drugs after they have an operation, after they have pain. They don't realize that they're going to get addicted. I mean, that's just as much of a problem as people who intentionally take fentanyl because they want to hide,
Right.
And that's all part of these cuts too, is all the educational aspect.
So, and, we have been making progress. When we cite statistics, I can tell you, I have met with so many families because of my own pain that I carry, is statistics mean nothing if you've lost somebody, right?
No, absolutely.
But they did drop. Opioid overdose deaths in the U.S. fell 17% in the last year that Biden was in office, because there was a bipartisan, and I think the chairman acknowledged that there was a bipartisan effort to address these things. So I am the last Democrat that gets to ask questions, Ranking Member Pallone. I know there have been some statements about a couple of things that I wanted to give you an opportunity to respond to, especially I think when we think about the fact that there is a role that Medicaid provides with regards to addressing issues around mental health and addiction, but I knew there were a few things that you wanted to respond to that had been asked earlier.
Well, I just want to refute, a lot of the Republican arguments today are based on the notion that, yes, these programs are effective, the treatment, the drugs, all this is going down. But then at the same time, when I come back, or Democrats come back and say, yeah, but you're rescinding $1 billion, you're cutting the people out that administer the program, you have a budget that basically eliminates all these programs, right? You're not going to convince me that somehow you're going to be able to continue this effort to reduce the problem with illicit drugs or people taking drugs if you eliminate the programs and cut the money that's been effective. But in addition to that, we don't have any information. We send letters, we send inquiries, we ask the administration, RFK Jr., okay, well, if you're going to get rid of SAMHSA and put it into Make America Great or whatever they call this new administration, right? how do you expect that you're going to continue these programs if there is no SAMHSA, if these different projects aren't available anymore? And there's no response. So to suggest that somehow, well, they're going to make it more efficient and we're going to be able to do the same thing with less money or no money or without SAMHSA, well, you got to explain to us how. And they don't. So I have no reason to believe that this reorganization, this lack of funding, all these things are going to happen, and it's just going to be as effective. No. And so that's why I think that saying you want to reorganize this program at the same time you know that all the money's disappearing, the SAMHSA is not going to exist, and you admit that it's helpful, is still going to continue. I think you're just delusional if you think that.
And, I'm always raising the issues about rural America because that is my beautiful district. And, the impact on the rural America that Mr. Chairman, the rural America that many of us know, will be devastated if we do not continue to invest actual resources and not just words. I mean, it comes down to where are you voting with regards to putting funding, because it takes people, it takes beds, it takes actual resources to provide the health care that those who are struggling with addiction and mental health deserve. If there's nothing else, is there anything else, Ranking Member?
No, thank you for the opportunity.
Okay. Did you want to respond?
I would just say that
Karen?
I just want to say, day before yesterday, I was in Eunice, New Mexico at the reduction plant, and that is rural. I thought I had rural districts. That is rural. Yeah,
I
it's beautiful
represented-
though. It's
yeah,
its
I
own. I
represented-
assume that's in your district.
Yeah, I
Eunice, New
represent
Mexico.
incredibly beautiful, the rural district. In many of my counties, there are more heads of cattle than there are people, and the people who are there like it that way.
Yeah, thanks.
Thank you very much, Chairman. I yield back.
Gentlelady yields back. I have counties or parts of counties where the sheep and the cattle outnumber the people. Yeah. Yeah, that gets tough. It depends. Yeah. Oh, in our area, they're all together. I now recognize Mr. Jack for his time of questioning.
Thank you, Mr. Chairman. And Chairman Guthrie, I want to ask you to elaborate a little bit on the advocacy groups that are supporting this legislation. As I understand, over 60 groups support this passage, and would love for you to expound upon the coalition aspect of us trying to pass this critical
Yeah,
legislation.
they are. I mean, this is an area that affects everybody, so there are a lot of advocacy groups that have joined to be for this bill. And I think if the biggest thing, if we get into I think the biggest thing, if you say you want these programs to continue, is to vote for this bill, and then it allows us to move this through the Senate. It's obviously going to take a bipartisan vote in the Senate for this bill to be signed, go to the president, and put it on the president's desk to sign. I think that's important to do. But we have a lot of advocacy groups. I don't have the list in front of me, but they're important.
Well, and we saw, after this was reauthorized in 2018, obviously we talked about at length today, a decrease in terms of opioid-related deaths. I'm just curious, could you speak for the committee on, let's assume we pass this and work together to do so, what's the impact 5-10 years from now if we get this done this Congress?
Well, I would like to say, as I said in my early statement, I think 83,000 deaths down to 54,000 deaths, which is way too many. And I want to see that number to continue to decrease. And we had 2,000 deaths in Kentucky last year. We have roughly around 1,000 car accidents. So we have more people dying for opioid use disorder than we have or just poisoning. Some people don't even know they're taking an opioid. They get a poison fentanyl pill. And so, but this, I think what we would like to see is a continued decrease. You know, the hope is to zero. I'm not sure that I'm going to predict that it'll go to zero over the next decade. But if we can continue to see the same decrease that we've had, it'll save substantial number of lives.
Thank you, and with that, Mr. Chair, I yield back.
Gentleman yields back. Now recognize Mr. Scott for his time of questioning.
Thank you, Mr. Chairman. And I don't really have any questions. I mean, I'm just looking at it again. It passed 393 to 8 and 98 to 1. 393 to 8 in the House, 98 to 1 in the Senate. Just, Chairman, do you expect a bunch of opposition to the legislation on the floor?
Well, I hope that it passes without a bunch of without opposition. But you know, I've always looked at things. I've had people before say, "Well, you can't vote for that bill because it didn't go through subcommittee or regular committee or regular order." And I've always told my staff said, you know what, I got to look at the judge based on the policy, not based on the process. And so hopefully if we do that, I think almost all of us, those numbers agree on the policy. I mean, it's bipartisan. Everybody understands how important this is, and hopefully the process won't affect it. We can get that kind of vote that you're talking about.
Mr. Pallone, are you opposing the legislation on the floor? Yes. Just out of curiosity?
Opposing it because I do
You're
believe,
opposing
you just want to know yes or no, or you want to know why?
No, you can,
No,
I
I'm
don't
a-
want, I don't want a dissertation on it, but you can tell me why you're opposed to this piece of legislation.
Well,
My gut is
because-
it passes 400 to 20 or something.
Yeah, I don't know what the final vote would be, but the bottom line is, I don't believe that we should be authorizing something as a committee or as a Congress and giving the impression that somehow this is going to lead to the program being improved. I don't think so. The money's being rescinded, the staff is being rescinded, and the agency,
So you would
SAMHSA.
allow the program to expire then?
Well, I think it's going to expire because of what the administration is doing. It doesn't matter whether we vote for it or not. They're killing it.
I don't agree with you on that.
No, I
respectfully,
understand.
But, I mean, I think it's kind of a ridiculous bill to be opposed to, in my opinion. I mean, look, every segment of society, if you haven't been to a funeral from someone who's died from a drug overdose, you're one of the few people in this country. I mean, and it's worked its way into every aspect of every society. And some of them die, some of them are just damaged permanently from it. But I hope the bill passes, and I hope, you know, when it gets to the floor that you'll support it. With that, Mr. Chairman, I yield.
Gentleman yields back. That concludes our questions. We thank the witnesses for being here. Thank you, Chairman Guthrie and Ranking Member Pallone, for your excellent testimony. And we'll take a brief recess, or no?
Just 30 seconds.
30 seconds. All right. Calling up the second panel as soon as we can get all those E&C folks to clear out. All right, we'll get back to business. I now welcome our second panel, Representative Van Dyne and Ranking Member Velazquez from the Committee on Small Business. Your full statement will be submitted for the record, and we ask that you summarize your statement in 5 minutes. Representative Van Dyne, I welcome you for your testimony. You're now recognized.
Thank you very much, Madam Chair, Ranking Member McGovern, and members of the committee for the opportunity to testify before you today. I am pleased to speak in support of 3 important bills which were recently reported favorably out of the House Committee on Small Business. And together these bills would restore proper oversight capabilities on small business lending company licenses, oversight which was irresponsibly undone by the Biden-Harris administration, and codify 2 of President Trump's key executive orders aimed at protecting American citizens from radical sanctuary city policies and rooting out fraud in SBA lending programs by ensuring taxpayer-backed loans are not granted to individuals unlawfully present in the United States. I'd like to begin by discussing H.R. 2987, the Capping Excessive Awarding of SBLC Entrants Act of 2025, or the CEASE Act, which is introduced by Representative Breshnahan from Pennsylvania. Small business lending companies, or SBLCs, are non-banking lending entities authorized by the SBA to issue 7(a) government-guaranteed loans. The SBA serves as their primary federal regulator, and in the early 1980s, the SBA imposed a cap on the number of SBLC licenses, citing limited and insufficient regulatory capacity. That cap remained in place for over 40 years, and the Biden administration moved to expand the program. Despite bipartisan concerns, the SBA under President Biden granted new licenses, including to at least one entity that ended up shutting down its U.S. operations just 1 month later. Without a doubt, these licenses were granted to institutions that lacked even basic financial stability. Although some of our Democratic colleagues have expressed agreement with the need for a cap, their only concern with this bill is the lack of the preservation of a pilot program called Community Advantage. As SBA Administrator Kelly Loeffler has noted, the Community Advantage Program is a perfect example of how the last administration weaponized government programs to tip the scale against deserving small businesses and toward preferred groups and political allies, even when it meant greater risk to the American taxpayer. H.R. 2987 ensures that future administrations cannot stretch the SBA's oversight capacity beyond what's reasonable, protecting the integrity of the 7A loan program. Next, I would like to discuss two complementary bills, H.R. 2931, the Save SBA from Sanctuary Cities Act of 2025, introduced by Representative Finstad, and my bill, H.R. 2966, the American Entrepreneur's First Act of 2025. Together, these bills represent some of the first legislative efforts on the House floor to codify President Trump's executive orders 14218 and 14159, which stop taxpayer dollars from being used to support illegal aliens and end federal taxpayer support to sanctuary cities. Sanctuary cities have become magnets for crime and chaos. These are jurisdictions where liberal politicians have chosen to ignore federal immigration law, giving violent criminals a free pass while endangering law-abiding citizens. You have to look no further than recent headlines to see that officials refusing to cooperate with ICE has led to a total breakdown of law and order. H.R. 2931 will require the SBA to relocate offices out of sanctuary cities that protect criminal illegal aliens by refusing to comply with federal immigration law. The amendment filed by Chairman Williams will ensure that relocated offices will still benefit small businesses in law-abiding cities. And it also removes the exemption for jurisdictions that provide safety to illegal immigrants who report or witness crime. H.R. 2966 requires citizenship verification for SBA assistance to ensure that illegal aliens are not approved for SBA loans, as they were under the Biden-Harris administration. An untold number of criminals, gang members, human traffickers, and terrorists were among the millions of illegal aliens welcomed into the country by the Biden-Harris administration. Many of these illegal aliens have sought refuge in sanctuary cities under local leadership, proud of the fact that they provide shelter to criminal illegal aliens. Innocent victims are paying the price. And I am thankful that the Trump administration is taking a whole-of-government approach to restore integrity to our immigration laws. At the SBA, Administrator Loeffler is tightening the requirements for loan applications and has announced that she will relocate the SBA's regional offices out of sanctuary cities. H.R. 2966 codifies these efforts so that future administrations will not redirect SBA loan opportunities to illegal immigrants. And H.R. 2931 codifies the Trump administration's effort to protect Americans from the crime born out of sanctuary cities. I appreciate you can continue considering my testimony today in support of these important measures, and I yield back.
Thank the gentlelady. Now recognize Ranking Member Velazquez for her 5 minutes.
Thank you, Mr. Chairman.
Opening statement.
Thank you, Mr. Chairman and Ranking Member and members of the Rules Committee. I appreciate the chance to testify today. I wish we were here to talk about bills to help small businesses grow or policies that address challenges like tariffs. Unfortunately, small business uncertainty is at its highest level in decades, and we're hearing their fears about rising costs from tariffs and chaos in supply chains. This bill does not address those issues at all. At a time when small businesses are struggling with so many challenges, these bills will limit access to capital, weaken proven lending programs, and punish entrepreneurs based on politics. H.R. 2966 would block legally operating small businesses from getting SBA loans. The SBA previously required that a U.S. citizen or permanent resident own at least 51% of a loan recipient's business. Under current policy, the SBA now requires a loan applicant to prove 100% ownership. We're starting to hear cases of owners losing access to loans just for 1% of foreign investment. Despite what my colleagues claim, the committee has not seen any evidence, and I repeat again, any evidence, not a shred of evidence, that this system has failed or undocumented immigrants are getting loans. This bill is the solution to a problem that simply does not exist. The bill also creates a massive compliance burden for SBA lenders. For years, my colleagues on the other side of the aisle have complained about reporting requirements under CFPB's Section 1071 regulations or the Corporate Transparency Act. So why the silence now? Requiring verification of citizenship down to the last percentage point could lead many lenders to stop participating in SBA programs altogether. Without lenders, access to critical financing will decline. It is a cruel policy that is already starting to harm hardworking entrepreneurs, especially at a time when many are trying to move manufacturing domestically. The SEAS Act will place a hard cap on the number of SBA licenses issued to non-bank lenders under the 7A loan program. I understand the interest in oversight. I was one of the first to raise questions when the SBA lifted the licensing moratorium. Unfortunately, this bill does nothing to protect community advantage SBLC holders, which focus small dollar loans to new and underserved businesses and has facilitated over $1 billion worth of loans to small businesses. Many industry stakeholders fear that the CA lenders will be eliminated, which will be devastating for rural, veteran-owned, first-time entrepreneurs. We should work together to strengthen the program, not push through legislation that could undo years of progress. Finally, H.R. 2931 will force the SBA to relocate its offices out of cities that Republicans have labeled as sanctuary jurisdiction. This will mean closing SBA offices in just because the administration doesn't like their politics. As we saw recently, DHS cannot always justify the sanctuary label, and even sheriffs are pushing back. Madam Chair, Mr. Chair, I would like to enter for the record two articles. One from the Chicago Tribune, list of sanctuary jurisdiction removed from U.S. government website following criticism. And then another one from NPR, Homeland Security, pulls down list of sanctuary cities and counties after backlash. There's no clear plan for how this regulation will work.
Without objection?
Thank you.
So ordered.
There's no clear plan for how these relocations will work, how much they will cost, or how they will affect services. This bill will dedicate taxpayer resources to arbitrarily moving SBA offices that are already operating effectively. This will hurt millions of entrepreneurs in our largest city who rely on in-person support to start, run, and grow their businesses. Each of these bills is going to hurt a large number of small business owners, which hurts our economy and community. Thank you. I yield back.
I thank the gentlelady for yielding back and now recognize Ms. Fishbach for her time of question.
Thank you very much, Mr. Chair, and thank you, Ms. Van Dyne. Is this your first time in Rules?
It is.
Well,
So be gentle.
congratulations. There you go. I didn't think I'd seen you before, Representative, but I appreciate you bringing the bills forward, and some of these are really important. I mean, really make a clear statement. And Representative Van Dyne, is there any reason why the federal government should continue to invest in office space and provide federal SBA jobs in jurisdictions that actively, openly defy federal law?
I would say no. In fact, what you're doing is you're putting those federal employees in harm's way. We have seen it. You don't have to look any further than what you saw this past weekend at what happens in cities that actually are harboring, that are protecting criminal illegal aliens. So we should not be putting our federal employees in harm, and that's exactly what we'd be doing.
And thank you for pointing that out, because that was the point that I wanted to make, is these are not free of criminals. They are, well, they allow these folks to stay. They are increasing the crime rate. They are putting people at risk. They are doing all kinds of things. The American Entrepreneur First Act would simply require that businesses receiving federal assistance be owned by American citizens or by lawfully permanent residents. How can this be controversial?
That's a great question. I don't know how this can be controversial. To the gentlewoman, my colleague from Small Business on the left, she says that there was no example at all of how this has been misused, except that there is. So SBA Administrator Kelly Loeffler actually identified a loan for nearly $1 million that went to a company that was owned 49% by an illegal alien. Thankfully, the SBA rescinded that loan, but the impact is that nearly $1 million in business loans was almost taken away from a legitimate American-owned entrepreneur. These should be focused on American businesses, American small businesses in particular, that have been so hurt over the last 4 years, and that's the direction of this bill.
And so it's far more controversial to leave it and allow that kind of fraud and abuse to continue than it is to change this so that it is clear what is going on. And actually, this bill does nothing to prevent people with temporary visas or illegal immigrants from holding jobs at those businesses. It doesn't prevent them from owning a small business. What it just prevents is that they get access to taxpayer dollars.
Correct.
And so I just wanted to, so I appreciate that you brought this forward, and I appreciate that you're prioritizing those folks that are tax-paying people and have legitimate status here. So I appreciate that. Thank you, Ms. Van Dyne, for bringing it forward, and I yield back.
Thank you.
Gentlelady yields back. Now recognize Ms. Scanlon for her time of questioning.
Thank you. We've heard some odd arguments, I think, in support of these bills, and I'll be honest, I really struggle to understand how it's going to help the small businesses in our region, because these bills don't seem to meet the needs of those businesses that are reaching out to our office for help as they try to particularly navigate the chaos, the economic chaos that we're seeing from Trump's tariff wars and the disruption to our economy and the Small Business Administration that have occurred over the first 5 months of this administration. So these are some of the first bills from the Small Business Committee to come through the Rules Committee since Republicans took the majority over 2 years ago, and they really seem to just be fodder for the Republican base and filler for the legislative calendar. It almost seems insulting to the nation's small business owners to get a bunch of lip service when we're not actually providing help to them. Right now across the country, our nation's small businesses are struggling to deal with the fallout from the president's disastrous tariff policies. Nearly every week, the policies change in a Truth Social post or a mean tweet, and we find out that this or that tariff is going to be higher or lower, that some are going to be delayed and others aren't, or that some amounts will be stacked and others combined. It's become a full-time job for businesses in our country to keep up with the effective tariff rate, let alone plan how they're going to handle the financial impact of those tariffs, which are essentially taxes on those businesses and their customers. So we've heard from dozens of small businesses in our district about lines of business that are being destroyed by the tariffs. Many are planning to lay off staff. They're canceling upcoming capital and construction projects. Some are facing the prospect of having to shut down completely. And these impacts are having ripple effects across our entire local economy. More unemployment, less business spending, and less investment. And then, of course, there end up being secondary impacts to contractors, to suppliers, and to buyers of manufactured goods, because most small businesses don't have the resources to ride out this kind of economic chaos like Amazon or Facebook or Tesla or any of the president's billionaire donors and buddies. If our colleagues actually care about small businesses and want to do something to help them, the number one thing they could do right now is find a spine and push back on these tariffs. But instead, Our colleagues and the Speaker have actually blocked the House of Representatives from considering any legislation to end the fake national emergency that has been relied upon as justification for these tariffs. The Constitution says that Congress is the arm of the federal government responsible for setting tariffs and regulating foreign trade, not the White House. Congress could end these tariff wars today, but instead the House majority is saying, oh, not our problem, just let the White House wreak havoc on the economy and disrupt our relationship with many of our closest allies. So then we have, in addition, we have these specific bills before us today that are only going to make it harder for small businesses to access Small Business Administration resources. If we look at H.R. 2931, a bill that would force the Small Business Administration to close existing offices in many of the nation's major cities, impacting tens of thousands of small business owners. How's that efficient? It'll be a massive waste of taxpayer dollars to relocate all these offices. As the ranking member maintained, we've seen no evidence that there's justification to do so. Our Republican colleagues, I don't think, have any legitimate evidence that a single undocumented immigrant has inappropriately received a small business loan. And as given our Republican colleagues' focus on cutting government bloat, why is it a good idea to add a whole new layer of compliance costs for the banks and credit unions that issue small business loans? None of this sounds very efficient either to me or to the small business owners in our region. It just doesn't really seem to help the conditions that actual small businesses are dealing with. Ranking member, I know that there was some discussion about what kind of evidence has been introduced to support these changes. Do you want to comment on that or anything else?
Well, I think that it's irresponsible to push legislation that will have an impact on small businesses and not having any type of oversight, any hearing in the committee, bringing expert witnesses to testify. And again, if you're saying that undocumented, ineligible people are getting those loans, show me the proof. Mm-hmm. You have only one thing that you're saying, one case that the current administrator is pointing to. I don't know, because we haven't seen it. Mm-hmm. She hasn't been before the committee, but I can tell you that this is going to be detrimental to small businesses. The bill harms American small businesses by preventing them from accessing credit. It likely violates the Equal Credit Opportunity Act. SBA lenders have been calling my office because they are concerned that if they deny these loans to these businesses, they could be accused of violation of ECOA. It runs counter to the SBA's mission and runs afoul of prudent underwriting by basing origination on borrowers' national origination, not the credit worthiness. And let me just say, the fact that only one case was found, even if it's true, it shows that the system works.
Mm-hmm. I appreciate your bringing those facts to light. You know, seeing yet another instance of trying to stir up fear of immigrants, et cetera, as a basis for some really radical policy changes that are going to really hurt small businesses and that are going to be a grotesque waste of taxpayer dollars, especially with closing offices, et cetera. Really appreciate your testimony, and I yield back.
Gentlelady yields back. Now recognize the gentleman from South Carolina.
Thank you, Mr. Chairman. I want to thank each of you for coming. You know, I think, aren't we talking about not letting illegals who are illegal in this country getting an SBA loan that is financed by the government?
That's the law.
Is that not? And so if it's not a problem, then you should vote for this bill. If it's not a problem, like you say it is, Ms.
No,
Blanquist,
sir,
then
because...
hold on, I'll let you respond.
Okay.
If it's not a problem, and then support it, because I think you'd acknowledge the 15 million or more in this country that President Biden let in. I'm in this world. I'm a developer. I'm the one that we've done the SBA loans. Tell me where I'm off.
So first, the Small Business Act prohibits any assistance to individuals who are unlawfully in the United States. That's the law. If there is a particular case, like the one that she mentioned, the thing that they have to do, the administrator, is to turn over that case to the Inspector General to investigate. We have no knowledge of any investigation. Well, we don't have an Inspector General in place anyway, but there is no evidence to show that undocumented immigrants are receiving SBA loans. This is what the law says, that they cannot, any unlawful person. But there are unintended consequences, where it's going to disincentivize banks, lenders, from approving those loans, because they are afraid that it will violate the ECOA, the Equal Credit Opportunity Act, and that they will be liable. That's what the lenders are telling us.
Ms. Van Dam, you want to respond to that?
No, I do. We know for a fact that there have been billions of dollars that were illegally, that were fraudulently expended by the SBA. We know this. Where have they gone? We're trying to find that out. But the fact is that the only thing that this does is make it a requirement to verify that these dollars are being given to people who are in our country legally, that are American businesses. That is all it's doing, is simply verifying. That is not currently required.
And the fact that the Biden administration didn't enforce it, that's the other problem, wouldn't you say?
We absolutely know that they didn't enforce it.
Because unless this figure is wrong, that the Biden administration approved a $783,000 SBA loan application in June of 2024 that was 49% owned by illegal immigrants. That's kind of a fact, isn't it?
That was uncovered under this current administration while they were reviewing.
And that's just during one.
Correct.
Well, do illegals that come into the country, have they paid into our Social Security, our Medicaid?
No, sir, they have not.
They hadn't paid anything in, yet taken advantage of a participation with the bank. And I will tell you, under the Biden administration, they just didn't enforce it. That's why they let as many illegals in this country as they did, to create, in my opinion, a power base. And it just didn't work. And now that this is this just solidifies what I guess Ms. Velazquez is saying is not a problem, but all you're doing is verifying it. They have to fill out an application. And the SBA application process is lengthy anyway. And I think in 23, the bank board I was on, we did it every month. And it was an extensive process. But under the Biden administration, they were almost scared to enforce it because of all these equal rights and things that, that they were worried about having to be litigated and sued over. You want to respond any?
I would say that what they did, and I heard this firsthand, I'm on the Small Business Committee, I heard this firsthand from a number of different lenders, that under the Biden administration, they were making them check boxes for a number of different DEI programs that was forcing dollars away. So if they want to talk about the added burden of what they did to our lenders, to small businesses, it was abhorrent. That was allowed to continue. This administration is putting an end to it. This is merely saying that for every dollar that has been given away to folks who are illegally in our country, is a dollar that was not given to hardworking American small businesses.
And what do you think this is doing for the price of housing and the price of commercial buildings, that they take money that should go to legal Americans? What is it doing for those?
It's obviously extending the burden on our middle class, on our working families, and on our small businesses.
A lot of the illegals that we've encountered, they've got a document. The Biden administration issued driver's license, issued fake Social Security numbers. So if they'll lie on that, if they'll lie with that, what else will they lie on? Ms. Velazquez, you want to answer any of that?
Where is the evidence, sir? Where is the evidence? Show me the proof. You just can't come here and make up things up without presenting evidence. And the administrator for 6 months that has been in office, has not come before the committee to answer questions and to share with us what is her opinion on the different proposals.
It doesn't work that way. It does not work that way. When you're
I
in a
can see
process,
that.
It does not work
And when
that
you
way.
talk about the billions of dollars that have gone to ineligible small businesses, yes, you're right. It happened under the first Trump administration when we implemented the PPP and he loosened up the guardrails on the PPP.
They're not being enforced under the Biden administration. Just
No.
like the borders
You-
were not.
you're
just
totally-
like the borders
sir,
were not.
you're totally wrong.
I'm reclaiming my time. Just like
Okay.
the borders were never enforced.
Yeah.
Open borders that derail this country. And the things that this is just codifying is a common sense. She should be forward if what she's saying is true. You want to
Well, the administrator is actually going to be in front of the Small Business Committee in the next week, and the administrator has already testified twice in front of the Senate. So she absolutely has been responsive. In addition, I would say that while they're looking at one example, there are plenty of examples. The only thing this does, if the administrator is correct, in which it is true, that this is part of law, all we're doing is saying it has to be verified.
And are there penalties with it if they falsify records?
I'm sure there are. That's not part of this bill.
Okay. Well, thank you for putting this up. This is, it's amazing we have to even argue about this, but it is. I yield back, Madam Chairman.
Thank you, Mr. Norman. Ms. Leisure Fernandez, you're recognized.
Thank you so very much for recognizing me, Madam Chair, and thank you for being here, Chairwoman. And I love it when there's two chairwomen, this Chairwoman and Ranking Member. But I do think that it is important that we stay rooted in fact. And the reality is there were no open borders during Biden. And in fact, Biden has deported more immigrants than Trump has, although he has done horrible things like deporting children who have brain cancer. They have deported citizens. They have acted in a manner that it is incredibly callous. But I wanted to give you some time, Ranking Member, to be able to answer some of the accusations that were made in a way that will allow you to do so without being interrupted. Ranking Member Velasquez.
Well, let me say that the law, the Small Business Act, requires and states clearly that an unlawful citizen person cannot access loans by the SBA, by the small business. That is clear. But here we have it. You know, the Republicans in the Financial Services Committee and in the Small Business Committee, they raised the issue of, Democrats imposing requirements and all these regulations that are impacting and killing small businesses. But they are advocating for this in this bill. This bill shows the hypocrisy of the Republican majority. The majority opposed both the CSPB Section 1071 rule and the beneficial ownership requirements rule because it was onerous against small businesses. With Section 1071, that information was voluntary. And now, under this legislation, it's a requirement. They have to comply. So it's just unbelievable. No oversight, no information shared with us on sanctuary cities, how many of these offices will be closing down, what is going to be the cost to SBA. 40% of the workforce are going to be eliminated, fired off, and they are taking on more responsibility, like student loans. Since when that is the mission of SBA?
So, I think that what we're finding today is what we find every time this Rules Committee meets and takes up legislation is time and again, Republicans are standing with the biggest corporations and the wealthiest Americans instead of with small businesses. And their actions continuously hurt mom and pop businesses. I need to tell you, that when I go across my district, and I've gone and met with small businesses, and they are terrified of what? They never talk to me about immigrants as being the problem. The tariffs are the problem. I have met with every store I go into, whether it's I'm buying something for myself or I happen to be in one of our rural areas, our stores and our small mom and pop businesses are suffering because of the tariffs. And the Republicans have refused to even take them up. They don't have the courage to exercise their constitutional duty to take up the tariffs. And instead, they do things like this, which will cost SBA a lot of money in their, it's sort of vengeful. I mean, Trump is sort of, and Republicans allowing him to have a policy of vengeance. So they want to blame immigrants for all kinds of things. They want to blame immigrants for all kinds of things, and that's not the issue right now. The issue is what mom and pop businesses are doing. In fact, it's so bad that we had small businesses sue the Trump administration over those tariffs, and they won the initial case, the initial determination. And what those small businesses in that case said are the same things. There's uncertainty. There's chaos. We don't know whether Trump is going to be a taco again or not, right? Trump always chickens out. But when Trump is playing his game of chicken, all small businesses can't order their inventory. They don't know whether they should raise the prices. You know, it keeps hurting them. Do you want to respond to that issue of what the tariffs are doing to our small businesses?
Well, small businesses are hurting under this administration trade policies. And that is the issue. They rather come here and talk about sanctuary cities, but they don't want to discuss the real issue. The Wall Street Journal Small Business Index found 58% of small businesses say the economy has gotten worse, 42 points worse than in January. 66% of small businesses believe tariffs are having a negative impact. 51% anticipate a recession, and a staggering 59% list economic uncertainty as their top challenge. So, but rather than focus on this issue that matter most to small businesses, like tariff, this administration is focused on hollowing out the agency, closing regional offices, imposing onerous requirements to small businesses and to lenders, impacting access to credit for small businesses, and eliminating funding for 15 valuable counseling and training programs at a time when it matters most for small businesses.
Right, and we keep hearing false statements, like this whole idea that the bad billionaire bill they passed last time we were in this rules for 2 nights straight. What was it? What were we up? I mean, ranking, Madam Chair, and you were up with the rest of us, right? I mean, it was like 2 nights where we didn't sleep, and we worked nonstop. But we kept hearing things that were not accurate, like the idea that that bad billionaires bill is not going to raise the deficit when every analysis, every economist says it will raise the deficits, and we hear Republicans saying it's not going to raise the deficits when we hear them trying to blame immigrants for Medicaid, saying 1.4 million. They do not receive Medicaid. Now, if certain states choose to provide that, that is up to the states, but they are not receiving federal Medicaid dollars, and Republicans keep repeating those lies. They keep repeating lies over and over again without proof. And that's what you're demanding, aren't you, Ranking Member Velasquez? That show us the evidence, not just the statements. And we are not seeing any of that, but we keep seeing them siding with big corporations where people like Musk. Musk even says that bad billionaires' budget is a bad thing. Although he made a lot of money. Maybe billions of dollars more that he's made since he's been associated with Trump. You know, the Trump organizations have made billions of dollars from these tariffs, doing these tariffs, right? So let's start talking about what's really good for small businesses. And the problem isn't illegal immigrants, because they are not getting those loans. The problem is the tariffs and the economic policies of President Trump. And with that, unless there's anything else you want to add, Ranking Member Velasquez?
We cannot continue to implement policies with total disregard to the ability of members of Congress to have the information provided by the administration. So the disregard for oversight and request for information, those are important issues for us to be able to do this in a responsible way.
And for that, it would serve both Republicans and Democrats to have good information coming from the administration. So that should be a bipartisan request and something we could work on together, don't you think, Madam Chair? And with that, I will yield back.
Thank you, Ms. Leger-Fernandez. Mr. Griffith, you're recognized.
Thank you, Madam Chair. If I could just set the record straight. I'm not sure exactly what the gentlelady was saying when she said that we were saying things that weren't accurate. And I'm not telling you I know that it's accurate or inaccurate. All I know is that 1.4 million illegal aliens being on Medicaid, particularly Medicaid expansion, is a CBO, Congressional Budget Office number. I didn't make it up. The committee didn't make it up. That's a Congressional Budget Office. No, I'm not going to yield. I'm just saying the facts. It's a Congressional Budget Office number that was given to us as members of the Energy and Commerce Committee. That's where that came from. It's not something we made up. We didn't just pull that out of the air. It seems like today we're being accused of just pulling stuff out of the air. I don't know what the number is. Madam Chairman, I make no statement as to that I have personal knowledge of the illegal aliens who may or may not be on Medicaid expansion. But the Congressional Budget Office said that by specifically saying they couldn't get it, we were going to take 1.4 million illegal immigrants off the rolls. So you can't have it both ways, I would say, Madam Chair. The folks who want to say that we're taking these people off of Medicaid, particularly Medicaid expansion, can't be saying that at the same time as saying they're not there or that we're making that number up. That number came from the Congressional Budget Office. Now, people who listen to me over the years know that I don't put a lot of stock in Congressional Budget Office numbers, which is why I'm not personally endorsing the number. I'm just saying that's what they said. That's where the number came from. It's not something that Republicans made up. And with that, Madam Chair, I'm going to yield back.
Thank you, Mr. Griffith. Mr. McGovern, you're
Well,
recognized.
first of all, let me thank both the witnesses for being here. I apologize that I was out of the committee room for a while. We had a leadership meeting. So let me just, having said that, let me just say I agree with every single word that Neva Velasquez just said. So I want to associate myself with her. But in terms of the CBO issue, I think I'll go back and I'll double check what they said about undocumented immigrants and healthcare. But if I'm not mistaken, they made a distinction between what is federally funded and what is state funded in terms of who is getting the healthcare. And there is a difference, especially when it comes to the stuff that we oversee. But I will be happy to get the details and pass them on to the gentleman. I yield to the gentlelady.
So, and I think that is really important, that you can't take a number that is in a CBO score that is about 1.4 million that states may be providing in their decision, and then say that it is Medicaid and federally funded. And I will send you, Madam Chair, I request to enter into the record an article by factcheck.org stating a false claim about illegal immigration and Medicaid.
Without objection.
And in here, it actually very clearly says that a state program is by definition not Medicaid. And that's the difference, that when you refer to the fact that there are people, and each state may make that determination, but that is not Medicaid, that is not federal funds, because undocumented cannot utilize Medicaid. So we should stop using that number. Unless you want to say there are 1.4 million who might be using state programs. But that's not what we fund. What we fund is Medicaid. And so over and over again, we see these kinds of numbers being used by Republicans. And in fact, one Republican senator, when it was pointed out, when she was talking about these 1.4 million, when Senator Ernst did, you know, when somebody said, well, you know, if you kick all these people off of Medicaid and, you know, that people are going to die, because if you don't get health care, you can die. And her response was, we're all going to die. I mean, I would think that we would have more empathy in this room than to say, well, it doesn't matter because we're all going to die, let them die. That's how that is heard. It is heard as let them eat cake. It is heard as if though the people on Medicaid do not deserve to have health care, do not deserve to live. And I think that the people on Medicaid do deserve to live. They do deserve to have health care. They should not be brushed aside and say, but we're all going to die. And I think that that is a key difference on how we look at the moral values of these issues when we face them. And thank you very much. I yield
I
back
thank the
to
gentlelady, and I again thank our two witnesses for being here, and I will yield back my time.
Thank you, Mr. McGovern. And I want to say, Republicans are the party of life. And to accuse us of not wanting people who deserve to be on Medicaid and deserve to live is deeply offensive to me. As Mr. Griffith has said, we're using a number given to us by CBO. And we do want people to live. And I'm, again, offended when people say that Republicans don't want people to live. We're the party that believes in life from conception to natural death. Mr. Jack, you're recognized.
Thank you, Madam Chair. And I just want to start, if I could, with Ms. Van Dyne. We'll talk about the two, your bill and Mr. Finstead's bill. So first and foremost, over 70% of Americans support President Trump's plans to ensure that we protect our country from the scourge, which is illegal immigration. And I just saw a survey earlier this week that over 70% of Californians believe that too, which you wouldn't necessarily expect. And I think it's because we all see that there is a drain on American resources and taxpayers. But I just want to affirm for the record, both of these bills, in my mind, help turn off the incentive structure that was around the previous administration that rewarded and incentivized illegal immigration. That's my perspective, but welcome thoughts from you, Ms. Van Dyne, on that.
No, I think you're absolutely right. Every dollar that goes to somebody who's in this country illegally is doing two things. One is incentivizing other people to come into our country illegally, and two is stealing it away from those who deserve it, from the reason why these programs were created. I do want to clarify a couple of things that have been said today. We are not shutting down any offices. We are relocating offices. The resources will still be there to help these small businesses that need it, but we are relocating them to cities that actually enforce the law, cities that actually care about the safety of their citizens. That is what we are doing. We're not shutting down offices. They're being relocated. When we were talking about earlier about small businesses and what they have heard over the years and how that the Republicans are not being responsive to the needs, absolutely. I would say that last week we actually passed a bill that is very responsive to every single small business that has come in front of the Small Business Committee that I've heard the last 5 years. They wanted a bill that identified tax cuts that allowed them to invest in the future, that allowed them to invest in the growth of their company. That is exactly what a bill that we just passed, the One Big Beautiful Bill, did, that every single Democrat voted against.
Well, thank you very much. And I'm very excited about your legislation, likewise Mr. Finstead's. And if I could, shifting to my fellow freshman classmate, Rob Bresnahan, has a great piece of legislation on which you testified. And I'm just curious if you could walk us through why it's important to ensure, in this case, let's say a future Democrat administration does not increase the number of SBLCs.
So expanding the number of SBLC licenses to 16 is a decision that should be made by Congress, not by unelected bureaucrats. Congress must ensure that the SBA has the ability to be able to manage any unregulated entities, which they have not in the past, that seek an SBLC license before some future administration fully removes the cap and compromises the integrity of the SA program with unworthy new SBLCs, which is exactly what we saw during the last administration.
Well, I appreciate you testifying. I think you've distinguished yourself in your first appearance before the Rules Committee. And with that, Madam Chair, I yield back to you.
Thank you very much. Mr. Scott, you're recognized.
Thank you, Madam Chair, and I'll try to be brief. But a couple of things were said. One is that the indication was there that we, as the federal government, actually label the sanctuary cities. But sanctuary cities have chosen themselves not to comply with federal immigration law or to share immigration information with federal agencies. Is that correct?
Yes.
So they have chosen to defy the law, it's not Congress that's saying, or some federal agency that's labeling them as a sanctuary city. They've chosen themselves to become the sanctuary city.
Correct.
And there should be consequences for that. The other thing is, I want to make it clear, when we talk about immigrants, if you are a legal immigrant in the United States of America, you still have eligibility, correct?
Correct. If you're going to be here long term, so they break it down for people who are here short term versus people who plan to spend the rest of their life and invest in these communities.
Right. But if you have a loan that you have to repay, that loan has a duration, and you're going to need to be here for a long period of time to repay the loan.
And that's exactly why we're defining it, because if you are here illegally, you risk the idea of being deported, and therefore you will not be able to pay back that long-term loan.
So getting back to this, that this was not a $10,000 loan that the SBA approved. And this wasn't something where someone had a 10% interest in it. My understanding is this was $783,000, and the illegal immigrant owned 49% of that company. Is that correct?
Correct.
How does somebody miss that unless it's willful ignorance?
This is what happens when we don't have them force the verification, and that's what this bill is trying to address.
I want to just finish with this. I went to the border just a couple of weeks ago, not with a big trip, but I talked to the people that were working the border and long-term employees of U.S. Border Patrol. And do you know that even if somebody had tattoos that would indicate that they were part of a violent group, that unless, now I'm talking about someone who had tattoos that basically said, I'm a part of this particular violent group, that unless there was a criminal hit when they put them in the system, that they were paroled into this country, even if they had tattoos that indicated that they were part of a violent organization. What happened over the last 4 years has done untold damage to this country. And I'm just glad to know, and I got to see it with my own eyes, the border's secure right now. And it's going, what little bit is happening at the border, I'm pretty sure President Trump's going to get a handle on the rest of it. I'm thankful that the border's secure. With that, I yield.
Thank you very much, Mr. Scott. Seeing no other persons to question our witnesses, you are excused.
Madam Chair?
Yes.
Can I enter into the record an article that I forgot?
Certainly.
Because when we were discussing sanctuary cities, reference were made about the fact of crime being rampant, rape, and all that. So I have this article from the Third Way, the 21st Century Red State Murder Crisis. So I would like for that to be made part of the record.
Without objection.
Thank you.
Thank you very much. Okay. Ms. McClellan and Ms. Bonamici, would you please join us at the witness table? You guys almost coordinated this morning. thank you all very much for being here. I know we usually go in alphabetical order, but Ms. McClellan, you're listed first, so I'm going to go ahead. You want to defer to Ms. Bonamici? Okay, that's fine. Ms. Bonamici, you're recognized.
Thank you, Madam Chair and Rules Committee members. As much as I'm tempted to weigh in on the prior bill, I am here with a refreshingly bipartisan amendment to the Support Act for patients and communities. In 2018, Congress identified the need to expand access to recovery housing in the Support for Patients in Communities Act. And the legislation established the Recovery Housing Program pilot to support individuals in recovery on their path to self-sufficiency. Recovery housing is not new. It has origins that can be traced back to the mid-1800s. These models have proven time and time again to meet the various and evolving needs of people with substance use disorders. They can be a critical asset in supporting an individual on their recovery journey. Specifically, the Recovery Housing Pilot Program that passed in the Support Act allocated funding to 25 states in the District of Columbia to provide stable transitional housing for individuals in recovery from a substance use disorder. The funding covered a period of not more than 2 years or until the individual secured permanent housing. And again, that was passed with bipartisan support in 2018. But the program was limited to a handful of states that had higher than average opioid overdoses and unemployment rates based on data that was gathered between 2013 and 2017. Because of the success of this program, I've introduced bipartisan legislation, which is H.R. 1231, the START Housing Act, to expand the recovery housing program to all states, not just a limited number of states, and promote better coordination between service providers. This bipartisan amendment inserts the text of my bill to strengthen and expand the recovery housing program to all states. And again, the pilot was limited. The pilot is working. There isn't a reason why we shouldn't bring that nationally. Further, the Congressional Budget Office confirmed that this amendment has no effect on direct spending or revenue. So I respectfully urge the committee to make my amendment in order so the benefits of the Support Act's recovery housing program can support people in recovery nationwide. Thank you, and I yield back.
Thank you, Ms. Bonamici. Ms. McClellan, you're recognized.
Thank you, Madam Chair. My amendment would prevent the Substance Abuse and Mental Health Services Administration from implementing any further mass layoffs. And that is because while I fully support the Support Act, I am concerned that none of the work necessary to implement it can happen without the SAMHSA workforce. SAMHSA leads efforts to address our nation's mental health crisis, including focused initiatives to reduce the rates of suicide and drug overdose. But on March 7th, Secretary Kennedy announced that SAMHSA would essentially cease to exist as employees are fired or absorbed into a consolidated office. And without an agency dedicated to behavioral health addressing suicide, overdose, and youth mental health issues, these issues are less likely to be prioritized. On April 1st, Secretary Kennedy fired nearly half of SAMHSA's remaining staff, including the director of SAMHSA's Center for Mental Health Services. He then fired the entire Office of Population Surveys, and this is the team that oversees the National Survey on Drug Use and Health, our only national survey focused specifically on drug use and mental health. And it is unclear who, if anyone, is going to take on this crucial task of tracking drug use and mental health in our country. In recent years, we have made progress reducing overdose deaths in large part due to SAMHSA's programs addressing substance use. But overdose deaths remain the leading cause of death for younger adults, underscoring the need to ensure that this program continues. And recklessly firing staff without cause deals a devastating blow to our efforts to prevent overdose deaths in America. SAMHSA also administers grants that support the 988 National Suicide Prevention Lifeline, which in its first year received 4 million calls, a 33% increase in people reaching out for help. Yet in February, a quarter of the 988 Lifeline team at SAMHSA was fired, and these are critical mental health programs. SAMHSA's Pregnant and Postpartum Women's Substance Use Disorder Treatment Program, which funds parent-child residential treatment and critical workforce training programs would be eliminated with about a 92% cut. But substance abuse is a significant factor and one of the leading causes of death in the maternal mortality crisis. In Virginia, SAMHSA grants fund programs tackling substance use, mental illness, grief, trauma, and challenges faced by individuals. And yet, this funding is at risk. And it's important to understand that these workforce cuts, these firings, these layoffs don't happen in a vacuum. The bill that this committee, that this House just passed, will cut Medicaid and will put at risk a lot of substance abuse programs that Medicaid funds, particularly in our rural areas. In addition, the president has proposed slashing SAMHSA's funding by almost another third, eliminating another 30 critical programs that focus specifically on substance abuse. So when you think of everything in a totality, I support the SUPPORT Act. I think the SUPPORT Act is critically important to addressing substance abuse and the maternal mortality crisis and the suicide crisis and the gun violence crisis, because many gun violence incidents are a direct result of either mental health issues, suicide, or mental health issues or suicide or drug addiction. And yet, if we don't have the workforce to implement the SUPPORT Act, what are we doing? We're wasting our time, and we are telling the American people, on the one hand, we're solving a problem when we're actually tying our hands behind our back to make sure the problem actually gets solved. And so with that, I yield back.
Thank you very much, Ms. McClellan. Ms. Fishbach, do you have any questions? Mr. McGovern.
I know I want to thank you both for your testimony. I think they're both important amendments, and we certainly will, well, let's hope they're made in order, but if not, we will certainly offer them and have a vote on them in the committee here. But, Madam Chair, I want to also request unanimous consent to insert into the record Rep. Davis' testimony in support of his amendment number 37 to H.R. 2483, which reauthorizes through 2030 the SUPPORT Act Section 7134 grants for trauma-informed services in educational settings.
Without objection.
And I'd like to ask unanimous request to insert, unanimous consent to insert into the record Rep. Salinas' testimony in support of her amendments number 17, 22, 23, 26 to H.R. 2483.
Without objection.
And I'd like to ask unanimous consent to insert into the record Rep. Capter's testimony in support of her amendment number 16 to H.R. 2483, which ensures funds from opiate-related settlements are used to address the opiate crisis and are not being used for unrelated projects.
Without objection.
And again, I thank you both for your patience and for being here, and I support your amendments. I yield back.
Mr. Griffith, you're recognized.
Thank you, Madam Chair. Respect both of these ladies very much. Appreciate you all being here to talk about your amendments, and I yield back.
Thank you. Ms. Scanlon, you're recognized.
Thank you. I'd associate myself with Mr. McGovern's remarks, and thank you for being here.
Mr. Norman, you're recognized. Ms. Leisure Fernandez, you're recognized.
Thank you very much, Madam Chair. And these are precisely the kinds of amendments where we are actually supporting bipartisan efforts, right? Am I correct that in essence, that what you're talking about, what you're each talking about has had wide bipartisan support in the past, is that correct?
My underlying bill and the amendment both have bipartisan support.
Yeah.
While I don't have any co-sponsors for my amendment, I will say that there is broad bipartisan support for making sure that we are addressing substance abuse, and I don't know how we're going to do that if we don't have the workforce to actually implement the bill.
Right. So, and we heard tonight, I think, a lot of bipartisan support for mental health and addiction and treating mental health as a healthcare crisis. But I agree with you, and we had that discussion earlier. You cannot do it without people. And you cannot fire the heads of these offices that deal with this and say you support this. So I appreciate your testimony and amendments, and it would be great if we could debate them on the floor and see what and see if we could actually let the members vote on them. Let's see what happens. Thank you very much.
Thank you, Ms. Leisure Fernandez. Mr. Jack, you're recognized.
I have no questions, but I will say, Ms. Bonamici, in a previous life, I've closely followed your first election, the special election back in 2012. So it's an honor to serve with you as a freshman here today and appreciate your testimony. With that, I will yield back.
Thank you for the kind words.
Thank you. Seeing no further persons to ask questions, I thank the witnesses again for being here. Let me say this exactly the right way. Anyone else seeking to testify on H.R. 2483, 2966, H.R. 2931, or H.R. 2987? Seeing none, this closes the hearing portion of the meeting, and our colleagues are free to leave. Thank you very much. The chair will be in receipt of a motion from the gentlewoman from Minnesota, Mrs. Fishbach.
Madam Chair, I move the committee grant H.R. 2483 the Support for Patients and Communities Reauthorization Act of 2025, a structured rule. The rule waives all points of order against consideration of the bill. The rule provides 1 hour of general debate, equally divided and controlled by the chair and ranking minority member of the Committee on Energy and Commerce or their respective designees. The rule provides that in lieu of the amendment in the nature of a substitute recommended by the Committee on Energy and Commerce, now printed in the bill, an amendment in the nature of a substitute consisting of the text of the Rules Committee print 119-4 shall be considered as adopted, and the bill as amended shall be considered as read. The rule waives all points of order against provisions in the bill as amended. The rule makes an order only those amendments printed in Part A of the Rules Committee report. Each amendment may be offered only in the order printed in the report, may be offered only by a member designated in the report, and shall be considered as read, shall be debatable for the time specified in the report, equally and divided and controlled by the proponent and an opponent, shall not be shall not be subject to an amendment, and shall not be subject to a demand for division of the question. The rule waives all points of orders against the amendments printed in Part A of the Rules Committee report. The rule provides one motion to recommit. The rule further provides for consideration of H.R. 2931, the Save SBA from Sanctuary Cities Act of 2025, under a closed rule. The rule waives all points of order against consideration of the bill. The rule provides that the amendments in the nature of substitute recommended by the Committee on Small Business, now printed in the bill, modified by the amendment printed in Part B of the Rules Committee report, shall be considered as adopted, and the bill as amended shall be considered as read. The rule waives all points of order against the provisions in the bill as amended. The rule provides 1 hour of general debate, equally divided and controlled by the chair and ranking minority member of the Committee on Small Business and their respective designees. The rule provides for one motion to recommit. The rule further provides for consideration of H.R. 2966, the American Entrepreneurs First Act of 2025, under a closed rule. The rule waives all points of order against consideration of the bill. The rule provides that the amendment in the nature of a substitute recommended by the Committee on Small Business, now printed in the bill, shall be considered as adopted, and the bill as amended shall be considered as read. The rule waives all points of order against the provisions in the bill as amended. The rule provides 1 hour of general debate, equally divided and controlled by the chair and ranking minority member of the Committee on Small Business or their respective designees. The rule provides for one motion to recommit. The rule further provides for consideration of H.R. 2987, the CEASE Act of 2025, under a closed rule. The rule waives all points of order against the consideration of the bill. The rule provides that the amendment in the nature of a substitute recommended by the Committee on Small Business, now printed in the bill, shall be considered as adopted, and the bill as amended shall be considered as read. The rule waives all points of order against provisions in the bill as amended. The rule provides 1 hour of general debate, equally divided and controlled by the chair and ranking minority member of the Committee on Small Business or their respective designees. Finally, the rule provides one motion to recommit. I yield back.
Thank you very much, Ms. Fishbach, you've now heard the motion. Is there any discussion or amendment to the rule?
Yes, Madam Chair.
Mr. McGovern, you're recognized.
I have an amendment to the rule. I move the committee make an order number 4, offered by Representative Tonko, which halts all efforts for HHS or DOJ to reorganize the Substance Abuse and Mental Health Services Administration until the date on which a federal law is enacted that specifically authorizes such a reorganization. And Madam Chair, the American people do not support dismantling the agency in charge of combating the overdose crisis in this country and firing hundreds of its workers. And yet, President Trump has already fired hundreds of these essential employees without congressional approval, and now he wants to eliminate SAMHSA altogether. If Republicans care about beating the opiate crisis, they should support my motion to ensure that the Trump administration does not eliminate this vital agency without a vote in Congress, without this body doing its job. I urge a yes vote on my amendment, and I yield back.
Thank you, Mr. McGovern. Any further discussion on the amendment? Hearing none, the question's on the amendment. All those in favor signify by saying aye.
Aye.
Those opposed say no. No. In the opinion of the chair, the noes have it. The amendment is not agreed.
Ask for a roll call, Madam Chair.
Mr. McGovern requests a roll call. The clerk will call the roll.
Mrs. Fishbach?
No.
Mrs. Fishbach, no. Mr. Norman? No. Mr. Norman, no. Mr. Roy? No. Mr. Roy, no. Mrs. Houchin? Mrs. Houchin, no. Mr. Langworthy? No. Mr. Langworthy, no. Mr. Scott? No. Mr. Scott, no. Mr. Griffith? No. Mr. Griffith, no. Mr. Jack?
No.
Mr. Jack, no. Mr. McGovern?
Aye.
Mr. McGovern, aye. Ms. Scanlon? Aye. Ms. Scanlon, aye. Mr. Neguse? Ms. Ledger Fernandez? Aye. Ms. Ledger Fernandez, aye. Madam Chair?
No.
Madam Chair, no.
The clerk will report the total.
3 yeas, 9 nays.
The amendment, and the noes have it, the amendment is not agreed to.
Madam Chair, I have another amendment to the rule. I move the committee make an order amendment number 20, offered by Representative Ocasio-Cortez, which requires the Secretary of the Department of Health and Human Services to release funds for the mental health and substance use block grants. Madam Chair, in early May, President Trump canceled more than $1 billion in funding for state and local health departments to combat the mental health and substance use crisis. The Trump administration argues that this funding was just for COVID, but the law itself is clear that these funds are to address mental health and substance abuse issues. This is just yet another example of how damaging Trump's slash-and-burn approach has been. This move hurt health departments in red and blue states alike. And this amendment would release funding that has been already approved by Congress so that it can be put to good use in communities across the country. I urge a yes vote on my amendment, and I yield back.
Thank you, Mr. McGovern. Any further discussion on the amendment? Hearing none, the question's on the amendment. All those in favor signify by saying aye.
Aye.
Those opposed say no. No. In the opinion of the chair, and the noes have it, the amendment's not
Ask
agreed.
for a roll call, Madam Chair.
Mr. McGovern requests a roll call. The clerk will call the roll.
Mrs. Fishbach? No. Mrs. Fishbach, no. Mr. Norman? No. Mr. Norman, no. Mr. Roy? No. Mr. Roy, no. Mrs. Houchin? Mrs. Houchin, no. Mr. Langworthy? No. Mr. Langworthy, no. Mr. Scott? No. Mr. Scott, no. Mr. Griffith? No. Mr. Griffith, no. Mr. Jack?
No.
Mr. Jack, no. Mr. McGovern?
Aye.
Mr. McGovern, aye. Ms. Scanlon? Aye. Ms. Scanlon, aye. Mr. Neguse? Ms. Ledger Fernandez? Aye. Ms. Ledger Fernandez, aye. Madam Chair?
No.
Madam Chair, no.
The clerk will report the total.
3 yeas, 9 nays.
The noes have it. The amendment is not agreed to. Further discussion. Ms. Scanlon, are you recognized?
Are you done? Yeah, I have an amendment. Thank you. Madam Chair, I have an amendment to the rule. I move the committee make an order amendment number 7, offered by Representative McClellan, which prevents federal funds from being used for mass layoffs of SAMHSA employees under reduction in force or similar processes. The Trump administration has already fired hundreds of workers from SAMHSA in violation of their rights and without approval from Congress. I know from firsthand conversations with service providers in my district how important SAMHSA's expertise is, and the gutting of that agency's expertise will irreparably damage the health and welfare of the American people. We sadly have a White House that doesn't care about whether the federal government can fulfill its mission to combat the opioid crisis by treating substance use disorder. Instead, the only goal seems to be how many people can be fired, how quickly can it be done, and damn the consequences. Supporting my motion would allow the House to vote on retaining federal employees with expertise important expertise in substance use and mental health programs. I urge a yes vote on my amendment and yield back.
Thank you, Ms. Scanlon. Is there any further discussion on the amendment? Hearing none, the question's on the amendment. All those in favor signify by saying aye.
Aye.
Those opposed say no.
No.
In the opinion of the chair, the noes have it.
I'd ask for a roll call vote.
Ms. Scanlon asked for a roll call vote. The clerk will call the roll.
Mrs. Fishbach?
No.
Mrs. Fishbach, no. Mr. Norman? No. Mr. Norman, no. Mr. Roy? No. Mr. Roy, no. Mrs. Houchin? Mrs. Houchin, no. Mr. Langworthy? Mr. Langworthy, no. Mr. Scott? No. Mr. Scott, no. Mr. Griffith? No. Mr. Griffith, no. Mr. Jack?
No.
Mr. Jack, no. Mr. McGovern? Aye. Mr. McGovern, aye. Ms. Scanlon?
Aye.
Ms. Scanlon, aye. Mr. Neguse? Ms. Ledger Fernandez? Ms. Ledger Fernandez, aye. Madam Chair?
No.
Madam Chair, no.
Clerk will report the total.
3 yeas, 9 nays.
The amendment is not, and the noes have it, the amendment is not agreed to. Is there further discussion?
Okay, do you have anything?
Ms. Ledger Fernandez, you're
Madam Chair.
recognized.
Madam Chair, I have an amendment to the rule. I move the committee add a new section to the rule providing for immediate consideration of HJ Resolution 91 relating to a national emergency by the President on April 2nd, 2025, under a closed rule, debatable for 1 hour, equally divided between the chair and ranking member of the Committee on Foreign Affairs. This joint resolution would allow discussion, debate, and a vote on whether to terminate the 10% tariffs imposed by the president. Madam Chair, we talked about what small businesses are caring about, and we also need to remember that we were sent here to do a job, and it is my job to remind us about that job week after week, and that is to exercise our duties under the Constitution regarding the tariffs. And those tariffs are hurting our small businesses, and in fact, recently, last week, a court with jurisdiction, the United States Trade Court, ruled that Trump had exceeded his authority in imposing the tariffs and ordered an immediate block on them. But it's really Congress's job. We should not be relying on the courts. We should be exercising our own obligation and our own duty to our constituents to have these debates, to vote on them, to have the courage of our convictions to say whether they should continue or not. So, Madam Chair, I urge a yes vote on my resolution, and I yield back.
Is there any further discussion on
Yes.
the amendment? Ms. Scanlon, you're recognized.
Thank you, Madam Chair. I do think this is particularly timely since not one but two courts last week ruled that the fake emergency declaration could not authorize these tariffs. So I think it's imperative that Congress takes it up, and we can't just suspend time until September to avoid the political fallout that might happen if our Republican colleagues were to oppose the White House on this. So I would wholeheartedly support this amendment.
Thank you, Ms. Scanlon. Any further debate or discussion? Hearing none, the question's on the amendment. All those in favor signify by saying aye.
Aye.
All those opposed say no.
No.
In the opinion of the chair, the noes have it. The amendment's not agreed to. Ms. Ledger Fernandez requests a recorded vote. The clerk will call the roll.
Mrs. Fishbach? No. Mrs. Fishbach, no. Mr. Norman? No. Mr. Norman, no. Mr. Roy? No. Mr. Roy, no. Mrs. Houchin? No. Mrs. Houchin, no. Mr. Langworthy? No. Mr. Langworthy, no. Mr. Scott? No. Mr. Scott, no. Mr. Griffith? No. Mr. Griffith, no. Mr. Jack?
No.
Mr. Jack, no. Mr. McGovern? Aye. Mr. McGovern, aye. Ms. Scanlon? Aye. Ms. Scanlon, aye. Mr. Neguse? Ms. Ledger Fernandez? Aye. Ms. Ledger Fernandez, aye. Madam Chair?
No.
Madam Chair, no.
The clerk will report the total.
3 yeas, 9 nays.
The noes have it. The amendment is not agreed to. Is there any other amendment or discussion? Hearing no further discussion, the question is on the motion from the gentlewoman from Minnesota. All those in favor signify by saying aye. Aye. Those opposed say no. In the opinion of the chair, the ayes have it. The motion is agreed to. Mr. McGovern requests a roll call vote. The clerk will call the roll.
Mrs. Fishbach?
Yes.
Ms. Fishbach, aye. Mr. Norman? Yes. Mr. Norman, aye. Mr. Roy? Aye. Mr. Roy, aye. Mrs. Houchin. Mrs. Houchin, aye. Mr. Langworthy. Mr. Langworthy, aye. Mr. Scott. Mr. Scott, aye. Mr. Griffith. Mr. Griffith, aye. Mr. Jack.
Aye.
Mr. Jack, aye. Mr. McGovern. Mr. McGovern, no. Ms. Scanlon. Ms. Scanlon, no. Mr. Neguse. Ms. Ledger Fernandez.
No.
Ms. Ledger Fernandez, no. Madam Chair?
Aye.
Madam Chair, aye.
The clerk will report the total.
9 yeas, 3 nays.
The ayes have it. The motion is to report is agreed to. Accordingly, the gentlewoman from Minnesota, Ms. Fishbach, will be managing the rule for the majority. Mr. McGovern will manage for the minority. Without objection, the committee is adjourned.